February 16th. Welcome to the Finance Committee. Our hearing agenda today will include 9 bills, maybe in this order, depending who comes and goes from other committees. Number one is Senator Bailey, Senate Bill 117. Number 2 is Senate Bill 485. 3 is Senate Bill 600. 4 is Senate Bill 412. 5 is Senate Bill 583. 6 is Senate Bill 648. 7 is Senate Bill 647. 8 is Senate Bill 516, and 9 is Senate Bill 821. So sponsors, you have as much time as you need to present your bill. Your panel will each have 2 minutes, and I hope that everyone will respect the time. It is Friday, so we don't want today to be any longer than it needs to be. So I just hope that we all respect each other and respect our time. So instead of Senator Bailey has Christina here, his Chief of Staff, to present Senate Bill 117. Christina, you have a panel, Kathleen and Ben Smith, and then we'll have 2 people virtually that we've brought on at the same time. You can begin whenever you're ready.
Good morning, Chair Bidle, Vice Chair Klossmeyer, members of the Senate Finance Committee. My name is Christina Vigorito, and I'm the Chief of Staff to Senator Jack Bailey. Today, I will be presenting Senate Bill 117 on his behalf. In short, this legislation would require that the infantile Krabbe disease be added to the Maryland Department of Health's newborn screening system. Krabbe is a neurological disease caused by the absence of an enzyme which leads to the loss of myelin, causing the nerves and brain to be unable to communicate. This panel will offer more information about the impacts of this disease, but if detected at the beginning of life, Krabbe is treatable, and the early detection of Krabbe allows for a transplant, which can drastically improve the quality of life and longevity for a child. However, this operation can only be done before the child is 6 months of age. Far too often, by the time a child is diagnosed, it is too late to begin the transplant process. Adding Krabbe to the newborn screening system will save the lives of children across our state. I wanted to also take an opportunity to share a bit of history on this legislation. 10 years ago, a very similar House bill was sponsored by Delegate Tony O'Donnell and former Delegate Jim Hubbard, who at the time had a very familiar face, who worked with him as his legislative aide, me. Lily, who is with us today, was a toddler at that point, and she happens to be the same age as my son. So the delegate and I took a very special interest in this topic at that time that I have clearly carried on to Senator Bailey today. Unfortunately, that similar bill died on sine die while it was before the Senate, and that conversation is not brought up before the legislature until now. Last month, the Federal Advisory Committee that is in charge of this type of testing recommended that Krabbe be added to the Recommended Uniform Screening Panel, which is called RUSP, for newborns. The Secretary of Health and Human Services on the federal level will make that final determination based on this recommendation. Senate Bill 117 will allow for Maryland to move forward without further delay for this life-saving screening for newborns. I believe that this committee also shares the sentiment that Maryland strives to be at the forefront of public health issues, especially ones that impact our children. For reference to the fiscal note attached with this bill, I think that Mr. or Mrs. Smith, who will be speaking after me, would be best suited to provide guidance and information relating to the costs that have been associated with Lily's care in relation to the estimated costs for testing for the machine that's referenced. At this time, I would like to address the letter of opposition from the Maryland Advisory Council, and I am certainly not a medical professional and very much respect those that are. It is a challenging career field, but this council's attempt to reduce this issue to a jurisdictional dispute or make this seem like it's an impossible task, as their letter does, is concerning for a list of reasons. In 2014, the council with different membership voted on adding Krabbe to the list of screening, and it failed to be added by 1 vote. This opposition doesn't seem to be focused on Krabbe specifically, but rather the council's position that no disease should ever be added to the newborn screening system by the policymaking body of the state, the General Assembly. The senator and I strongly disagree with them. It has become this body's obligation to act in this instance since the advisory council has been proven that their process causes additional delays and they have only been legislatively tasked to review federal recommendations regularly. The council does not have a requirement to act on any recommendations that come from the federal level. It is my understanding that earlier this week, there was a meeting of the council after the House hearing where the chair explicitly asked that they come back with a commitment on adding Crab Bay, and instead, we were informed that they'd move the goalposts to extend their time to review from 90 days to 120. This is a test that can be feasibly done and is being done in other states. It can save children's lives or drastically improve their quality of life and the lives of their family. That is even before we talk about the benefit to public health that comes with early detection and treatment of these diseases or disorders. 11 states have added this screening for newborns. 9 out of those 11 have done that since 2014. This legislation offers a unique opportunity to allow our state to catch up with some of our neighbors. We now have more scientific backing than those states did with their decision from the Federal Advisory Commission. And somehow we seem to be having the same arguments today that they had 10 years ago that are focused more on process rather than saving these children's lives. In researching and learning more about that process, I've been made aware that at least 2 more diseases have been recommended by the federal panel that also have not been adopted by the state. I won't claim to know the specific reasons for those decisions. My only purpose in bringing this up is to say that just because the federal government adds something to the recommended screening panel doesn't mean that Maryland is automatically going to follow suit. It is understood that there used to be a risk of false positives from this testing, and there was a serious concern that waiting for that confirmation or the need for additional testing could take a toll on families or their children. However, it's my understanding that now there is a 2-tier screening test that Dr. Matern from the Mayo Clinic created that would eliminate that potential additional invasive testing and the concerns that used to exist surrounding it. As a parent, I know that I would want to be given the opportunity to make informed decisions for my child on what is the best option to move forward with any kind of potential treatment, especially since the time frame for this is so narrow. Adding this screening would give that ability for parents to be informed and make those choices for their child from the start without limiting access or barriers to being able to have that screening from the start. In this time when the General Assembly has worked so diligently for open government, I believe this advisory board may suffer from a lack of transparency throughout their processes. Their webpage does not exist. When you go to the Department of Health Newborn and Childhood Screening page, the right-hand side at the very bottom says Advisory Council. When you click it, it takes you to a dead link. Quite simply, it is time to add Crab Bay to the newborn screening system. The State Advisory Council may choose to do this at some point, but this body can guarantee that it happens now. How many more years are we going to continue to wait to save lives? And how many lives have been impacted that we missed in that 10-year time frame? The senator has submitted an amendment to this bill, which is in your packet, that will specify that this legislation will only apply to infantile Crab Bay disease to be consistent with the federal recommendation that's been made. For those of you in this room who knew or had the opportunity to work with Delegate Hubbard during his long tenure in Annapolis, you probably heard him say on occasion, good bills take many years. It is my hope that this would be one of those good bills, and I'm proud to testify in front of you with an attempt to finish some of the work that he started. And I respectfully request a favorable report.
Thank you, Christina. You did a really good job. Your senator should be proud.
Thank you.
I guess next we'll have Ben Smith. Thank you.
Good morning, Chair, Vice Chair, and members of the Senate Finance Committee. My name is Ben Smith, and I'm here to speak to you not only as a father of a child affected by Crab Bay disease, but as a former voting member of the State Advisory Council for Hereditary and Congenital Diseases, which is the body that governs newborn screening in the state of Maryland. My experience with Crab Bay leukodystrophy began in March of 2012 when my 4-month-old daughter Lily was diagnosed with this disease at Children's National. We were told not to Google the disease and to go home and take lots of pictures and plan a funeral. We soon found out that our baby girl would die by the age of 2. Obviously, she has not because of intervention. But we found out that other states were also screening for this disease. And so my immediate response to that was to contact all of my legislatures and to help me find out, to help me understand how this could happen in the state of Maryland. Our state delegate responded, Delegate Tony O'Donnell, And a bill was drafted to add Krabbe to the newborn screening for Maryland. It sailed through the House and the Senate, but would die on scene at the hands of Senator Roy Dyson, my very own senator, because his name was not on the bill. The next year, we attempted to resubmit the same bill, but was met by opposition from the Department of Health via the Speaker of the House at the time. Their argument was that there was a state advisory council that reports to the Secretary of Health on newborn screening, and that we should take up the issue with that council to get the disease added to the list of that were screened via newborn screening. I started attending advisory council meetings in 2012 and was soon appointed as a voting member of the council by Governor O'Malley. Over the course of the next 6 years, I would attempt to get the advisory council to take action to save the children of our state, only to be met by a council wrapped in disorganization and bureaucracy. I would often drive 2 hours to the Department of Health headquarters in Baltimore, only to find that the council meeting had been canceled and or that there were not enough members present to make any substantial headway on any issue. The agenda of the council was and continues to be a constant game of kick the can. The council religiously depends on the addition of conditions to the U.S. Department of Health RUSP before taking any action at all, and never responds preemptively. I saw firsthand the ineffectiveness and disorganization of the advisory council and the lack of empathy for the parents and children of Maryland. The council is made up of primarily of geneticists from various area hospitals, and I often got the impression that they felt that they needed to protect their field of study over providing the Maryland parents with adequate information concerning the health of our children. I ask you this: what is the purpose of this council if the council must see a condition added to the RUSP before considering it for the children of our state? Why must we wait to protect our children? Why are we wasting time and resources re-examining conditions and treatments that have already been thoroughly vetted by medical professionals from throughout the nation and the world? Should not the purpose of the advisory council be
Mr. Smith, I've let you go way over time because your testimony is important. I'm going to assume it's all here written.
I'm
Is-
closing right now.
Okay, thank you.
Thank you, ma'am. Why are we wasting time and resources re-examining conditions and treatments that have already been thoroughly vetted by medical professionals throughout the nation and the world? Should not the purpose of the advisory council be to set Maryland as the standard for newborn screening for our nation? And yet these experts must witness action on the federal level before we take action for the children of Maryland. We have tried the process and the process is broken. Senators, I ask that you support Senate Bill 117 and for the children yet to be born in our state. Thank you.
Thank you. Kathleen, were you also going to testify, or?
I was, but if we're over time, it's okay.
I pretty much figured I was giving him 4 minutes instead of 2, so
Sure.
thank you.
I was.
Anna Gretham is virtual. Anna, would you like to start?
Thank you. Good morning. I'm Anna Grantham, the Newborn Screening Director at the Hunter's Hope Foundation. For 25 years, we've wept with families reliving the same nightmare caused by a symptomatic diagnosis of Krabbe disease. Their baby is born, seeming to be perfectly healthy. Just a few months later, the baby is relentlessly screaming in pain. After weeks or months of suffering in this diagnosis, parents learn their baby will continue to suffer as they rapidly lose milestones until they're unable to swallow, cough, speak, laugh, smile, and have lost almost all basic involuntary function. Parents are told to take their baby home, make them comfortable, and to prepare for their funeral. Krabbe disrupts every system and function within the body, and 100% of these children die, usually by their second year of life. No child should have to suffer like this. when there is a screen and treatment available. Newborn screening for Krabbe profoundly improves length and quality of life. Children diagnosed and treated before the onset of symptoms are spared from the suffering untreated babies experience, and they are so full of life. They go to school, play with their siblings and friends, they're independent, they smile, laugh, communicate, and they live. Krabbe disease was just voted for inclusion on the federal recommended uniform screening panel and includes cycosine to identify babies with Krabbe disease without falsely identifying babies who are not at risk. Those babies can be cost effectively screened at birth with other risk conditions Maryland is already screening for and diagnosed in time to have a better chance or to have a chance for a better and much longer life. They deserve to have this chance. Furthermore, Maryland is home to one of our leading leukodystrophy care network centers at Kennedy Krieger, where babies who screen positive for Krabbe can receive expert care and treatment for the disease without leaving their home state. Please, let's work together to save these precious children's lives. Thank you.
Thank you, Anna. And Joanne Kurtzberg,
Hi, can you hear me okay?
we can't hear you. Thank you.
Great. My name's Joanne Kurtzberg, and I'm a pediatric transplant physician at Duke Health. For the past 3 decades, I've studied treatment of patients with leukodystrophies and with hematopoietic stem cell transplantation. This therapy replaces the patient's blood and immune system with donor cells, producing normal enzyme, while enzyme-producing microglial cells are also replaced in the brain. After transplant, enzyme levels in the blood are normal for life. In Krabbe disease, where both the central and peripheral nervous systems are affected, transplant rescues the brain or central nervous system, but is less effective in rescuing the peripheral nervous system. In addition, in infantile Krabbe disease, transplant is most effective if performed in the first 3 to 6 weeks of life. That both justifies and challenges newborn screening for Krabbe disease. As you know, newborn screening for Krabbe disease has evolved over the past 2 decades, thanks to the outstanding and courageous work of Dr. Joe Orsini and his team in New York State, Dr. Michael Gelb at the University of Washington, and Dr. Dieter Matern at the Mayo Clinic. The algorithm for newborn screening for Krabbe disease has been developed and optimized. On January 30th of this year, the Advisory Council for Heritable Disorders in Newborns and Children voted 10-3 to add infantile Krabbe disease to the RUS. The core disease approved is infantile Krabbe disease, and that is Krabbe disease with an onset of symptoms before 1 year of age. The approved testing algorithm is a GAL-C screen followed by second-tier testing with cycosine on screen-positive babies. All babies with infantile Krabbe disease will have a cycosine greater than or equal to 10 nanomolar. Please note, results of molecular studies are not needed to make the diagnosis of infantile Krabbe disease. With this approach, the rare baby with infantile Krabbe disease can be diagnosed in the first week or so of life and rapidly referred for consideration for hematopoietic stem cell transplant today, or maybe gene therapy in the future. There are myths to dispel about Krabbe disease, but the most important one is that rapid referral for evaluation and treatment of newborns is possible if the proposed testing algorithm and a prospective roadmap for rapid referral and treatment is in place. Specifically, it's possible to confirm diagnosis, refer for transplant in or out of state, procure a cord blood donor, obtain authorization, work up the patient, administer chemotherapy, and transplant before 30 days of life. It's not easy, and it requires prior planning and a transplant readiness roadmap, which many of us are happy to help you put together. In summary, newborn screening for Krabbe disease saves lives. It also significantly improves quality of life for these babies and their families. In the past 7 years, 51 babies were born in states that were not screening for Krabbe disease, and these 51 babies had no chance. Infantile Krabbe disease will be officially added to the RUSP in the next few weeks. Please approve Senate Bill 117 to add infantile Krabbe disease to the Maryland newborn screening program today. Thank you for your time, and I'm happy to answer any questions you may have.
Thank you. Do I have any questions from this committee for this panel? Anyone on this panel? No questions. Thank you very much for your testimony, your virtual testimony.
You're welcome.
So next, we're gonna have the unfavorable come up.
Thank you, Madam Chair.
Thank you. So Dr. Kaliana Rama is unfavorable and Ada Hamish is unfavorable. Are you here? Good morning. Dr. K, would you like to start?
Good morning, yes. Good morning, Chair Beidle and members of the committee. I'm Dr. Nilesh Kalyana-Raman, the Deputy Secretary for Public Health at the Maryland Department of Health. I'm here to testify in opposition to Senate Bill 117, which would add Krabbe disease by legislation to the Maryland Newborn Screening Panel. I wanted to clear up front that we are not opposing screening for Krabbe. We do have to advance our care for newborns with congenital disorders. And what I'm asking is that we allow the Maryland Advisory Council on Hereditary and Congenital Disorders to do the job that we've entrusted them to do, to navigate these complex medical issues and ensure that we both screen newborns with congenital disorders, but also do it right so that they can get the treatment that they need. So right now, as has been mentioned by others, the federal government is actively deliberating this issue, but they haven't finalized their recommendation on screening for Krabbe. I'm glad to see that this step has taken place. And in fact, since the last time that they took this up about a year ago, they've advanced their understanding of what is and isn't effective in this area. And I think it's a good example of how nuanced this discussion is, that we see these issues evolving in real time. They're being deliberated and changing at the federal level. And that's the kind of nuance that our advisory council is tasked with navigating. What's the right screening method? And that best practice is changing. How do we ensure follow-up on positive screens? What does that mean for Marylanders? And then how do we set up pathways to ensure that children get treated? Children in Maryland get treated. The Advisory Council has already committed to taking up Krabbe as soon as the HHS Secretary releases the finalized recommendation. I've been communicating with the chair of the council and have gotten that commitment. I'm committing that the Maryland Department of Health will take up any recommendation from that advisory council as soon as they make it. I'm a primary care doctor. I've been treating patients for many years. I will wrap up in a second. I know that it is agonizing to wait and watch. Speed is important. Accuracy is the other piece that we have to ensure. And I'm committing that we'll have both speed and accuracy in this process. And that's why I'm asking for an unfavorable decision on this bill. Thank you for your time, and I'm happy to answer any questions.
And Ada?
Hi, my name is Ada Hamish, and I am a MD and a Master of Public Health. So I'm a public health and clinical person. I am the clinical director of the Department of Genetic Medicine. I'm a clinical geneticist. I want to just state before I tell you my opinion that Dr. Jamie Fraser, who is the chair of the council, could not be here today because she is a leukodystrophy doctor in her clinic, and it could not be changed quickly enough. So you have her written testimony. Please read what she has to say. I served as chair of the Maryland State Advisory Council on Hereditary and Congenital Disorders from 2000 to 2009, and I still continue to follow their activities and to give my opinions. The composition of this council is mandated by statute and includes experts from both academic medical centers in the state, as well as public health experts and citizens affected with conditions that might be considered. So it is a representative council whose composition is mandated, and it's been an effective process for a long time. The issues, as just stated, are complex and require medical and public health expertise, which is present on the council, and outside experts are also called in to present and discuss new conditions. This is not a process that should be subject to political pressure. It is nuanced and difficult, and there's no the point of my opposition, again, is not against Krabbe disease, although that is a complex condition, and there have been major advances that now makes it safe to do newborn screening for Krabbe. It was not necessarily safe or effective and had downsides up until this moment with the second tier screen. It's really changed the clinical care, and that's the point. This isn't, you guys have so much to be expert about. This is not, no newborn screen should be legislated. There's a process that's effective in the state. And 2 years ago, you changed the process to say that we have to address conditions added to the RUSP. So you, as a legislature, have done exactly the right thing, but that this has a process in place. So I am opposed to this bill by the fact that no specific condition should be added by legislation. Thank you for your time and happy to answer any questions.
Thank you for your testimony, and we do have a couple questions. Senator Lamb.
Sure. Thank you, Madam Chair, and thank you for your testimony. And appreciate you bringing up that legislation from 2 years ago. That was actually Senator Hershey's bill. I know the chair and the vice chair were both co-sponsors on that bill from 2022 that, to summarize, I don't know if you had a chance to fully articulate what that bill does, which is now law. It says that any conditions identified by the federal regulatory process to be put on the recommended uniform screening panel, the RUSP,
Right.
that the state's advisory council would have to take up for consideration as soon as it's final on that RSUP,
RUSP, just call it the RUSP. Yeah.
the RUSP list. So any federal conditions that are added to the RUSP list as final need to be taken up by the advisory council. What that bill that Senator Hershey had did included provisions that the advisory council could choose to not include any RUSP identified condition. But if it did that, it would have to report back to us, to the General Assembly, why it chose not to do that.
Correct.
And
And,
so-
and take it up the next year.
And continue to take it up the next year. And so it sounds as though Crab A is going to be very soon or has already been finalized as
Not
part, not
finalized.
finalized. Okay,
Almost.
so very, very close
Yep.
to being added to the RUSP list, at which point the advisory council will be taking up the Crab A recommendation for consideration to be added to the state
Correct.
list, then, correct?
Correct. There's already a timeline for which they'll be doing it. As soon, we're waiting for the secretary's final recommendation, and then there will be hearings. And I'm sorry that the link is dead. I'm not related to that. We'll fix that link. I'm assuming
We'll get that
immediately.
taken
Yeah,
care of.
but hearings are open. They are advertised, and experts, both opposed and in favor, are always invited to address the topic. It was not addressed earlier this week because there's a few other things going on right now, and we don't have a final recommendation from the Secretary of HHS.
So is it the commitment of the, I know you're not
I'm
technically
not. It
speaking
is
with the council,
absolutely
but
the
I
committee.
guess.
There, it is absolutely, they met on Tuesday. They have a bill, a letter that they're writing in response to Delegate Pena Melnick to say what the timeline will be. And just, I want to say one other thing. It hasn't really been brought up, but I want to say it. The council recommends, right? We review and recommend. And
Yeah,
then
this is the
there's
department.
and then there's an implementation component, which is not trivial. And there's two aspects. There's buying the machine and hiring the people. And then this, you don't just want to diagnose somebody, you need to treat them. So you need the rest of it's a program, it's a newborn screening program. So you screen and you treat, and getting the infrastructure in place to quickly see these patients, in this case, a bone marrow transplant or whatever else it might be. There are different treatments for different conditions that we screen for. Those are things that have to be done carefully, judiciously, and involving all the different academic centers and the primary care providers. This is not an overnight thing. It's complicated.
So the statute says that the advisory council can approve, and it also needs to be approved by the department. Is it
Correct.
the commitment of the department that you will not overrule what the advisory council decides if they decide to recommend the addition of this?
We rely on the advisory council
Okay.
for their recommendations, right? That is we don't have that expertise in-house at the department, so we rely on them for
So
that.
it's not the intention of the department to overrule the advisory council if the advisory council recommends.
I can't promise, but it is absolutely not our intent to do that.
It's never happened. It's just a
It's
matter
never
of
happened.
time.
Okay.
It is not.
But has it ever happened that the advisory council has not taken up right away a recommendation that's come down from the federal government in addition to the RUSP list?
So there are.
If I may,
Yeah,
for this
please.
one, I can't speak how far going back, but I can tell you that right now, every single RUSP condition has been approved and is moving through. There are two left that are in the implementation process. And I've been speaking with Chair Dr. Frazier about their implementation timeline and have her commitment that as soon as the next meeting will be called, as soon as this is finalized by HHS.
So at least as far back as we've looked, we've never seen a condition that's recommended by the feds on the RUSP list, never approved or having not been approved by the advisory council.
Correct.
I guess just process wise, then is there any reason to not just automatically include any condition added to the federal RUSP list to our state screening panel?
You know, now I would say they probably won't, but the automatic still requires a discussion, a consideration. I can't really imagine something, but we have a state that has for instance, Iowa is different from Maryland, right? So there might be a condition where we might say, well, this test, let's take CF. We do CF by IRT because our population, if you just did Delta F508, the common CF, you would miss people because we have a 1/3 African-American population that has a different mutation. So we chose a different method, and you do need to take that into consideration state by state based on the population of the state. Again, these are nuanced, complex things that need to be discussed. I can't imagine a no, but I can imagine that we might look at the way that they recommend and say, you know what, we'll do that, but we want to add this, or we don't think we need this. I can imagine approaching it a different way in our
But
state.
I guess I'm just asking process wise.
We would take it
there's
up.
adjustments to take it up,
Yeah.
but like, why do we need the advisory council then to reapprove something that's been approved by the federal government and put on the RUSP list? Like the feds, I would presume through their regulatory process would have decided across the board for all states that this should be added to their panel. The actual implementation piece can be decided
course.
by you and the
Mhm.
department on how to do that, but
Of
why
course.
not just automatically add everything that's coming down from the federal RUSP list to our screening panel?
Yeah, I can't think of a whole lot of reasons that it wouldn't happen, but it allows for that. And the consideration of the condition also allows for the consideration of it starts the discussion of the implementation, what it means, how fast, what do we need to do? I mean, we have had long delays on approved conditions from implementation. So that, I mean, it isn't, I don't think we've had long delays on consideration. The automaticity, I mean, if you wanted to legislate automaticity, but I think the discussion among these people, okay, here's a new condition, let's consider it. And then let's consider how we want to do this in the state is the thing that by taking it up, it starts the discussion of the implementation. I don't think saying do it automatically. Okay, how, who, what?
So you're drawing a distinction between the approval and then the implementation piece, that you could auto approve quickly, but it still requires some time to implement, to find the right
decide how to,
machine and how to.
Well, and also for the council to decide, like right now, there are 3 things. So let's say we're going to take up Crab A and decide by the end of this year, we're going to do it. And there's GAMT and there's MPS 2. That's 3 different conditions. In what order, what machine, who do you hire, how? Those are discussions that the department will decide, but the council will have input on the pressure placed on which one has to go. And also some things need really completely different infrastructure built. So Crab A is going to need somebody to be able to do a hematopoietic stem cell transplant within 6 weeks. That is not a trivial matter. That's a big deal. So putting together the infrastructure to have the academic centers or the outside of the state centers be able to do this. And by the way, one of the biggest delays for all these things, this is really an aside, is authorization by the insurance companies, including our own Medicaid, to pay for conditions that are mandated to be screened, but I can't get them covered. So that's a bill we really need, by the way, but that's for next
I
year.
agree with you.
Yeah,
I
let's
see
talk
the
about that,
insurance in the
because
back.
Yeah, it's, and anyway, so that's a huge problem. We've had 3-month delays on kids with SCIDs to get their bone marrow because Medicaid won't pay for it.
So back to the
Yes,
family here,
yes.
although I agree with you because I see the insurers in the back, but we're smiling. But to the point of the family here, I
Yes.
think it might provide them some reassurance,
This will
just
be
process, just
Yeah.
process wise, if
Mhm.
we automatically add things that are coming down from the RUSP list, because based on our research, we have not found any conditions that were added by the federal government that we didn't eventually add. And I understand that can take some time to implement, to find the right machine and tools and the
Sure.
right population that you're targeting. That's all needed and important. I think most families agree you want these screening tests to be targeted to the right folks, but at least it would give them the reassurance that if there are conditions that are being added by the federal government, that they would automatically be added by the state without having to go through this process of, approval through the council. Just a thought process there for consideration.
As a condition, yes. As a method, can we please talk about it? Like
Sure.
for what's appropriate to our state?
Thank you.
Kyle?
Yeah, thank you, Madam Chair. And I guess just to follow up a little bit on that. So if something gets on this RUSP list, what's the timeline then by the time that it's actually approved and implemented? What's the average process and timeline for something
So
for the
approved
commission
by
to
the,
approve it?
by the
Yeah.
council,
or the council?
it has to be taken up within a year. And in again, I can't find a condition that hasn't been approved. Implementation can take a very long time. So at the moment, and I don't want to throw
I'll
MDH
speak
under
to
the
the
bus. Yeah,
implementation in a minute.
we've had some like delays.
So, okay. So how long, just I guess, so from the time it's on the Rust list to the council making a decision to, how, like, I guess, is there an average? How long does that process take?
Sure. So in terms of the council, as she noted, they have to take it up. It's going to take somewhere between average 4 to 6 months
Uh-huh.
to work through all the details that she just described in terms of screening, follow-up, treatment, and particularly for this, there's a time sensitivity to treatment. For the implementation side, it can take anywhere from 6 to 12 months because we do have to see what equipment we need. Do we have the equipment? Do we need new equipment? Then we have to go through procurement, and then we have to typically validate the tests as well, which does take time. It takes a number of months to do validation.
Okay.
And so there is a time component in this that we can't shorten on the laboratory side for the screening. But once we're at congruent to getting those methods set up, we're also working through the pathways of how to follow up on those tests, working with council to really make sure that when we do see a positives, we have a pathway to deal with it, because those positives typically then need follow-up to ensure that they're true positives. And we want to make sure that we're pretty accurate about that piece.
And, you know, I understand the merits of trying to ensure that there's a proper process set up and that we making the right decisions. I just, the sense that I'm get though, is like that it's little solace to a parent, especially when if something can be done right now, if they have a limited time window in order to do something, otherwise they can't, you know, that
Yeah.
really provides little solace to them. Don't you agree?
I totally agree. And I mean, this is the frustration both on the parent side and even in the, in taking care of folks. We may think of it as right now, but there are a lot of steps that actually have to be implemented to make it real, right?
Mhm.
And there isn't a good way to shorten that.
Yeah.
I'd be happy to go into more detail, but things like testing, validation, follow-up, those take time to make sure that we're actually correct when we do this work.
And then I think the other thing too that I've heard earlier from Christina, from the senator's chief of staff, that she originally was working on this bill back, I think, in 2014, and so it also feels like in the family that were here earlier, with their child, it feels like this feeling of why hasn't something been done. So maybe can you tell us a little bit what does the test do? I mean, I've got kids, and there's the screening when you just like prick their foot and blood test. Like, how is this test actually done?
Yeah, so that's actually one of the challenges with Krabbe specifically, is that there's an initial test and a test for enzyme levels, and question was how much do those enzyme levels correlate to diseases. There's an infantile version, a juvenile version, an adult version, and they kind of have different manifestations. The tests were, at least the prior iterations of what was considered the right test, were catching a lot of folks, a lot of newborns, and there was a lot of wait and watch to see, do they develop Krabbe in infancy? Do they do it later? Do they develop it later in life? A lot of testing. And so a lot of the work that's been done just in the past few years has been trying to tailor that down and take some of that knowledge and say, okay, what can we actually do here, right? Watching a lot of children without offering any treatment or any actual sense of whether they're going to develop it or not is not fair to those families either. And so a lot of the work that you're seeing at the federal level is to narrow that down to the infantile version. But even that discussion, which just happened about 2.5 weeks ago, that vote. So when we say right now, like, we are in the middle of them deliberating, right? We're waiting for them to finalize. And we haven't actually seen a condition where they specify the exact testing and exact cutoffs. That's really not how it works.
Yeah.
It's always been, here's a condition to test for. You need to go test for it. And there's published methods and validations, but this is evolving in real time. And I think that makes it hard, right? To say legislatively, this is what we must do. We actually do rely on the RUSP and the advisory council to provide guidance on exactly how to execute this stuff. And we rely on the federal government to say, what is it that we should be executing?
Yeah, and I appreciate that. Just one more question, Madam Chair, but but 11 other states right now, is that right? Are currently testing for it with the newborn screening, is that right?
11 other states are, and in fact,
Okay.
their experiences are their experiences and the things that I was mentioning in terms of screening, catching a lot of newborns, many of whom did not develop it, actually went into refining this decision, right? To where the HRSA team is actually able to say, okay, we have a narrower band that we're actually able to influence the course of disease here.
Yeah.
And that's the infantile version. And it's the reason also that 30 other states didn't do it, is because it was really murky. I mean, I understand that 11 did it, but also it's been challenging for them as they work through this
Mhm.
as to what's actually the right thing to do.
Okay, thank you, Dr. K. Thank you, Madam Chair.
Senator Kramer.
Thank you, Madam Chair. As I've been sitting here listening as a parent and as a state legislator, what concerns me is that I'm hearing a lot of bureaucrats speak. What I'm not hearing is we are going to get this resolved. I heard repeatedly, this is not something that can be done overnight. It's complex, it's nuanced, it's difficult. Those are all the words I just heard. I also heard testimony prior to your coming up that this dates back to State Delegate Jim Hubbard's efforts, probably almost 15, 20 years ago?
10.
So when I hear we can't be rushing in to do this, and this bill's going to create a panic, and the people will be rushing out in the streets terrified because we don't have time. It occurs to me there's been 2 decades in which to be addressing this. As we just discussed, 11 states are out in front of the great state of Maryland in addressing it. So there, in my mind, seems to have been more than enough time. There just hasn't been the catalyst. And when I hear the words, no newborn screening should be legislated, that causes me concern. Every one of us sitting here was elected by the residents of this state to represent their best interests. It is our job from time to time to intervene in areas where historically we might not do so. But when we see an injustice that has occurred for nearly 2 decades, and we have families that we represent as state legislators, it is our job to hear them and on occasion intervene. What I did not hear is, okay, were you to pass this bill, can you give us, because we don't, we haven't addressed it for 20 years. We've got a website that's dead and doing nothing. And what we're hearing is, okay, well, we're going to work on it. And by the way, it sounds like it's only because this bill was introduced that suddenly now there is, we better do something about it. But we still haven't even bothered to get up a functional website. And so the concern, I believe, is that if we as legislators representing the families of this state and their babies, that this could still go on for yet years. And so what I'd like to hear is, if we pass this bill, what is the timeline that you all might need? If you don't think, and I did not see anything in the bill, and I could be mistaken, that specifies a date certain, and it may be in here, as to when it will occur, and other beyond the typical October 1 effective date. Do you all think maybe, okay, we'll maybe need another month, perhaps 2 months, in order to fulfill what the other 11 states are doing? And I'm guessing we don't have to reinvent the wheel here in Maryland when there are other states out in front of us doing the right thing for their residents. So do you all think you need just a little additional time to get it done? Were this deliberative body to decide, you know what, historically, we don't intervene, but we clearly now see the need to do so. So would you need, are you saying you could not do it by the effective date of October 1? I mean, I'm confident we've got the brain trust here in Maryland to do what 11 other states are doing.
So,
but please, do we need a little more time? Is that your concern?
So if I may, Senator, I just want to note that I did commit that we would move expeditiously on this. And so but I want to note that right now, like I said, the federal government is putting into place their recommendations on the type of testing that is different than what's happening in other states or as they are moving, right? And so we're not trying to we actually don't want to replicate what most of those states are doing, because the federal government is saying we're looking at the evidence and it's changing. So to directly answer your question, we are committing to, as soon as the federal government says this is how it should happen, to figure out how it should happen and then to put it into place.
All right, but here's my concern. Once again, we rely on the federal government and then it gets kicked down to you all. It could once again be years. Why is it that you all can't adapt in real time if the feds come down with something different than what Maryland adopts to accomplish this simple test to help our children, when we know that without it, they do have a death sentence? So why can't we, with Johns Hopkins University, the university, and we've got some of the greatest minds on the globe right here in Maryland, why can't you get this done? And then if the feds come down with something slightly different and you all conclude this is a better route to go, why can't you then just in real time, instead of, this bureaucratic, it drags out, we've got to, have this and that. Let's act, let's move, let's help our residents right here, right now, not at some undefined date in the future.
so this will be considered without question, but can I just take 10 seconds to give you a public health thing? It's not that kids are watched, okay? If you screen positive, that's why this new second tier screen is essential, because the watching of a possible false positive is an every 3-month brain MRI, spinal tap, and something called nerve conduction velocities where you put needles in. So it's a very invasive watching of a false positive, which is why this secondary screen changes the game. This has not been ignored. This has been taken up over and over again, both by the RUSP and in Maryland.
And does the secondary screen exist now?
Yes.
Perfect.
So
Then
it will be taken
you
up and
just-
implemented.
Perfect. Then you just acknowledged that now you've got that secondary screen. And by the way, I was seeing a lot of heads shaking no as you were describing the process about watching, but you just acknowledged Yes, we've got that secondary screening right now.
It's not set up in the state. It exists. We know
I-
how to do it.
Understand,
Yeah.
because we've refused
Didn't
to
exist.
do it in the state. And again, and I won't belabor the point any further. All I'm saying is, I, for one, as I indicated, as a parent and a legislator, will be pushing to see if there's an opportunity to get this bill passed, to do what has not happened over a 20-year time frame. And what I'm hearing sadly is, just give us more time, not a defined period of time, just more time. And with that, Madam Chair, thank you very much.
Thank you, Senator Kramer. Senator Glassmeyer?
There, we have 11 other states are doing this, correct? Do you stay in communication with those states to see how those tests are being run?
Yes, of course.
And say, for instance, there's a child born here in Maryland, and then there comes a time where you could have the test. I mean, not all children get this test, correct? There are symptoms that make you.
We diagnose it in this state by symptoms. That's correct.
Okay. So is there a way you can work with other states to do testing out of our state into one of the other testing areas?
We can implement this as newborn screen, and
Yeah,
it will
I
be
mean-
implemented this year.
Sure.
Because according to the fiscal note, as you said, you have to buy the equipment, you have to do this. Can't you partner with another state? That's my question.
So I'll take that since that's the laboratory. The fiscal note is not a barrier to doing this. It's simply a fiscal note. We will figure that out. That's from our mind, that's just telling you what it's going to cost. But we do, because it's newborn screening and every newborn gets screened. We do all the newborn screening at our state laboratory. And that's the way we can process all of these right now, 60+ conditions, right? So we can do them all at once. So we don't send that out. We, in some very limited instances, we do second tier testing. So the follow-up testing that can get sent out, and that's a much smaller amount. We've already begun discussions to Senator Kramer's point at 2 years as well about what that testing pathway is going to need to be for this.
Okay, well, and I agree with Senator Kramer. Get on it and do it. So, thank you.
Thank you, Madam Vice Chair. I have just a couple quick questions. Dr. Kay, I was happy to hear you say the physical note wasn't going to be a barrier because it does have a significant physical note, but I guess there's money in the health department to handle that.
We have a newborn screening fee that's actually one of the lowest in the country, and we're going to be looking at that. But yes, that's how we can manage changes to our newborn screening program.
So I learn new things every day. I never realized there was a RUSP. And so how long ago did the federal government put this disease on the RUSP list?
It has not yet.
It's not on the list yet.
It is not on the list yet.
Okay.
They are actively discussing putting it on the RUSP. The recommendation was made about 2 weeks ago,
Okay.
3 weeks ago, sorry, to the secretary, but they still have to finalize what the recommendation is going to be.
Okay. And you talked about a false positive and the need to then follow up. And
Mhm.
somewhere in the testimony, I thought I heard that once symptoms begin, it's like really too late to start treatment.
So that false positive piece is part of the changes that the federal government is considering, using a different test as the second line test to one, focus narrowly on the infantile version of this, so that we're not identifying children who may develop it at a later time. So that's the change that we're really, to the point of implement it now, we're literally trying to figure out what it is that we're implementing right now.
And are there ever false negatives?
Not with it.
That's the goal, is to not have any false negatives, right? And so that's why the screening test is initially quite broad, and then you narrow down.
Thank you. Senator Lamb, do you have another question?
A quick follow-up.
Go ahead.
While the questions were going forward, we were looking back at some of the records here, and it does look like there has been some delay in some conditions that have been considered by the advisory council.
Mhm.
And I think that was in part the impetus for Senator Hershey's bill from 2 years ago, that when we look back, for example, X-linked adrenoleukodystrophy,
Mhm.
there was a delay from like 2015 when it was added to the federal RUSP,
Mhm.
and it wasn't actually approved by the advisory council until 2023. That's like
No. We approved it right away. It's implementation. The
There was
advisory
an implementation issue there.
Yeah. council
Oh.
approved it immediately. We were a pilot state. We have a big leukodystrophy clinic. That's an implementation problem, not a council problem. And it
So
is.
that test took 8 years to implement?
I can speak to that. There were a lot of delays. I'm not telling you those are acceptable. We've actually implemented it. And that was one of the things that we made sure we got done last year.
Okay. I'm sure what more to say. So
I-
2015 was when the advisory council recommended. That was also when it was added to the federal RUSP list. It took 8 years to implement and actually get that test in place.
Until last year, yes. Last year it was implemented.
Okay.
And that's one of the changes that we are ensuring is that we're going to implement these tests when they come out of our advisory council.
Okay.
Thank you, Senator. I see no further questions. That ends the hearing on Senate Bill 117. Thank you.
Thank you.
Thank you.
We actually next are going to hear the bill that I called out was going to be 9th because Senator Feldman is here for Senate Bill 821. Chair Feldman, you have a panel.
Yeah, and I think we've got Commissioner Brain virtually.
Virtually,
Hopefully
we'll bring
she's-
her up. And
Yeah, MI Commissioner Brain's here in support. Madam Chair, first of all, it's great to be back in my old committee. And also, I bring to you a 2-page bill, study bill. So with, to my knowledge, no opposition, et cetera. So let me, just by way of a little bit of background, the last few years, those of you who read the Comptroller Learman's report about, Maryland's economy being a bit stagnant when it comes to private sector job creation. It was a read that's a little bit daunting. And a couple of years ago, there was a lot of attention in this committee actually about the manufacturing sector of our economy. We're really not punching. We're punching basically below our weight class when it comes to the manufacturing sector. And so, and I, quite frankly, just statistically, we rank 46 in the country in terms of the proportion of private sector workers employed in manufacturing. And I believe I'm on the email list of the minority leader. I'm sorry he's not here today, but he talks a lot about that in his email blasts, which I receive on a regular basis. Any event, that sector, is going through a lot of changes. I mean, the digital economy, a lot more incorporating advanced technologies, automation, big data, et cetera. And in recognition of that, this committee in 2021, piece of legislation from Senator West, Senate Bill 444 at that time, entitled Transforming Manufacturing into a Digital Economy Work Group. It created a work group, making it in Maryland. It passed out of this committee and then 46-1 in the full Senate, established a 24-person work group tasked with creating policies and programs to help Maryland's manufacturers identify skill gaps in this emerging advanced tech environment. And the work group was made up of industry, academics, nonprofit, government workers. It started its work, the 24-person work group in September 2021. It concluded with a report in December of 2022, and one of the members of that work group was none other than your own Senator Johnny Mouse, right to my right. And they focused primarily on small, and by the way, in your packet, you'll see the final report from December of 2022. And that work group focused primarily on small-sized businesses, which make up, as many of you know, a majority of Maryland's manufacturers, the backbone, quite frankly, of Maryland's economy. About 85% of Maryland's manufacturing businesses are very small, including a large percent of women-owned, minority-owned entities. Particularly about 96% of Maryland businesses are 50 employees or fewer. And that's all in the packet that I've submitted. And that work group came up with 9 specific recommendations. But I want to direct the attention of this committee to specifically recommendation number 4, which is, I think, specifically germane to this committee involving the healthcare space, but specifically recommendation number 4 recommended that that legislation be passed by the General Assembly that would open up PEO, professional employer organizations, which are known as PEOs, to let them access to any manufacturer with 50 employees or fewer. Small businesses would have access to PEOs in Maryland. What is a PEO? Professional Employer Organization. These are entities that can provide comprehensive everything from human resource solutions for small businesses. You can outsource HR functions, payroll, retirement, training, tax administration, regulatory compliance assistance, and also have the ability to offer health insurance plans through the PEO's large group health plan. We have about 500 different PEOs across the country. But currently in Maryland, you can use these PEOs for, again, HR work, payroll services, pension, retirement plans. But in Maryland, they cannot access a PEO's large group health plans. We're one of only 3 states in the United States of America that prevents small employers that are engaged with PEOs from participating in the PEO's large group plans, even though those plans might oftentimes result in a massive savings on healthcare costs for those businesses. There has been concern in Maryland about what impacts that allowing small businesses to do that would have on our small group health plan market. So all the bill basically does, so the recommendations came out of the, I'll call it the Mouts work group in 2022. And the recommendations there, but there was no further study or no further analysis done, even though we have 47 states that actually allow our small businesses to utilize the PEO concept. And so while the recommendation of this, all HB Senate Bill 821 does is to take a look at and study it. It will be a study done by the Maryland Insurance Administration. You'll hear from MIA Commissioner Bahrain. And so you'll see in the bill, it's directed to basically, it's beyond healthcare. If we're going to open this up for a study, let's take a look at a lot of things. Determine the impact of proposed statutory changes related to not just healthcare by PEOs on the small group market, but also identifying, comparing regulations under federal state law in the 47 other states, review the history of PEOs and how they've changed over time. Again, a lot of emphasis on health plans, examine regulations, et cetera, et cetera, et cetera. So a comprehensive review by MIA about whether we should change Maryland law, align us with 47 other states. And that's basically in a nutshell. We're focusing specifically on this 50 or fewer employees. That's the category that cannot currently use PEOs for healthcare plans. The study will be completed by December 31st, 2024. And again, no opposition. I think there's strong business support. We have one witness here in person, and again, Commissioner Bahrain virtually. And with that, Madam Chair, I'd ask for a favorable on Senate Bill 821.
Thank you, Chair Feldman. Mr. Sanchez?
Sure. Thanks. My name is Ken Sanchez, and I am the presiding CEO and president of a company called Chesapeake Specialty Products at Sparrows Point. We manufacture steel abrasives and foundry sand additives. We're recognized globally, and we do a lot of exporting, which is obviously good for the state. I was going to go over some other things, but I think I'm going to go off topic a little bit just because this bill is not just important for manufacturers. It's important for all the small businesses in Maryland. Okay. Small businesses make up what, I think it's 99.5% of all businesses in Maryland. Okay. But yet small businesses need to get people working for them. So what do? We pay the highest salaries we can. We try to get the best healthcare we can. But this healthcare is incredibly expensive. Okay. And it's not just expensive. If I don't know how many of you guys own small businesses now or have had small businesses. If you do, you know, it's really difficult. You're trying to, juggle all these balls, and then now you got to offer healthcare for your people, but you don't want to just give them some bad healthcare plan. You want to give them the best healthcare you can give them. So it takes incredible amount of time, but as a small business, we don't have these resources. There are companies like that are these PEOs. We use them now in the state of Maryland for things like paying our bills, like for instance, Paychex and ADP. They do a great job of helping these services, so we don't have to do some of that. The big companies have these resources. We don't have that. For healthcare, not only does it allow these healthcare companies to negotiate, the PEOs can negotiate for the small businesses and lower the rates. That's important because for a small business owner, we're paying approximately, and this is an average across Maryland, 77% of all healthcare costs to our employees, okay? That means the employees on average only paying 23%. Okay, so when you talk about the ACA and things like that, it's a great program for people who aren't making very much money. But in a lot of these small businesses, our employees are making pretty good money. And when you try to use the ACA, it's more expensive than what we offer. So we're paying all this money to help our employees, and we need good healthcare, but yet we can't get the same advantages as the large companies. And the last thing I'll say that's super important for this PEO program, these large companies get incredible amounts of data from these programs, so they can recognize what's the best program to feed their employees. So somebody in Maryland, maybe Baltimore City might be different than somebody on the Eastern Shore. We can get that data if we're part of the PEO, because as a small business, I can't ask for that data, but as part of a PEO, we can. So with that, thank you.
Thank you.
And this is just a study, so please, I'd like to get this moving.
Senator, I was happy to see you don't have any senators or delegates on the study group, so thank you.
But by the way, thank you, because that was a really good study group.
Can we finish the panel before questions? Thank you. Commissioner Brain, thank you for being here.
Thank you. Good morning, Madam Chair, or I guess good afternoon, Madam Chair, Vice Chair, and members of the committee. Thank you for the opportunity to testify today and to testify virtually. HB 821 would require the MIA to prepare a report that addresses professional employer organizations with a specific focus on the ability of small employers who have engaged the services of the PEO to also access the large group health plan sponsored and administered by the PEO. As has been noted, Maryland is one of 3 states that effectively prohibits small employers from participating in a PEO-sponsored large group health plan. I don't get into the mechanics of that here, but I will echo Senator Feldman's statement that this prohibition reflects longstanding concerns about what it would mean to open up other health plan options to the health of Maryland's small group market. Our state has always been very protective of that market and any leakage from participation in that market. In addition, I will note that when small group reform legislation was developed, maybe starting about 40 some years ago, it is very true that there were organizations that called themselves employee leasing companies or PEOs, but were really just schemes to avoid compliance with offering small group mandates. And these schemes often provided inferior coverage. But in the intervening years, PEO regulation at the state and federal level has expanded considerably and is quite robust, both at the federal level and in other states. And PEOs have become a tool that are used by many successful small businesses to provide, as noted, not only payroll and HR services, but access to health, welfare, and retirement benefit plans and packages. It is a way for some small businesses to offer the level of benefits that you would normally see in a Fortune 50 company at a lower cost. So in Maryland today, small employers can, as noted, take advantage of certain of the welfare benefit plans and retirement benefit plans and packages sponsored by the PEO, but not the health plan. I would just note that the purpose of this study is to give you information so that as you look at policy options going forward, you have up-to-date current information to help you with those future decisions. And the MIA has the resources to do this work. We've talked to the sponsor about it, and we're happy to do it.
Thank you very much. Now, I see a question from Senator Ellis.
Okay. Yeah, thank you, Madam Chair. And thank you, Senator Feldman, for this bill and focus on manufacturing. So you mentioned other people putting legislation in for manufacturing, and you didn't mention my bill. And but you Senate Bill 30 this year. And so I just want to say it so if I was like, I don't know.
I have no comment. Okay.
Yeah. So no, I'm just filling you in with that, and to bring high impact manufacturing in the state, because that statistic you mentioned, that we're like 47th, I believe, in the nation when it comes to manufacturing.
Right.
I mean, and like 1 is the best, right? So 47, you kind of
good.
I'm sorry.
Not good.
1 is no.
One is the best.
1 is the best. So
47
at 47, it's not good. We're like
That's
at the
right.
bottom. And as a state, we really don't focus on this. So I'm happy for this bill to do that. So each year since the Biden administration passed the CHIPS Act and Inflation Reduction Act, several bills, an average of $300 billion in foreign direct investments comes into the US. 300 billion on average since 22. And Maryland has not really taken advantage of that. So the bill I put in, Senate Bill 30, is to encourage that to happen. Do you think, Senator Feldman, and I don't know, that if we pay attention to manufacturing, we could bring quality jobs into America, and not just jobs, but people who own these companies and all the ancillaries to build wealth, like the governor talked about building wealth, especially in those folks who have been deprived of wealth building opportunities. Do you think manufacturing is a good vehicle to
Okay, well, Senator Ellis, let me just say, I think the witness indicated this bill is designed to help small businesses well beyond just manufacturing. I think we need all hands on deck. The reality is, whether it's the Learman report or any other number of metrics, where our economy in terms of private sector job creation is lagging. You know, our GDP in the last 10 years relative to Virginia, we're at 1.8%, they're at 4.5%. That was in the Learman report. So this work group that Senator Mounts was on, I think and they came up with, I said, 9 different recommendations to the issue of manufacturing. I'm picking out one of those recommendations in the healthcare space for small employers that I think we need some additional study, which, again, we're out of line with 47 other states that let their small employees of 50 employers of 50 employees or less utilize this option that is not available to Maryland small businesses. So I think there's a lot to your question. There's a lot in that report. It's several hundred pages of detailed review, reports, data, research about manufacturing in Maryland with a bunch of recommendations. I'm just picking out a small snippet in this bill largely on this PEO concept.
And I understand that.
Yeah.
I'm just happy that, you're attacking this one issue at a time, because there are a lot of parts to this sector that we need to act on. So thank you.
Right. And I look forward to reading Senate Bill 30
Yes.
and find out what's in there.
Thank you.
Thank you very much. Commissioner Brain, thank you for taking on this study, because we've looked at this issue for a long time, and I think, you're going to be a lot of help, and we appreciate that. Do I have any other questions for this panel? Thank you
Okay,
very
thank
much.
you, Madam Chair. Thank you very much.
So next we have Senator Hayes, Senate Bill 485, Family and Medical Leave Insurance Program. Senator Hayes, you have Secretary Portia Wu, Daniel Newberger, and Reagan Vaughn.
Indeed. Thank you, Madam Chair. Thank you, members of the Senate Finance Committee. The panel will come up to the podium. Madam Chair, I had some talking points. I'm gonna be really, really brief and just describe the 3 things, because I know the hour is getting late. We've been here for a while. We have a long agenda today. The changes in this bill, Senate Bill 485, are categorized in 3 categories: time shift, administrative changes, and clarifications and corrections. I will let the department review the specifics of the requested change, but I want to point out many of these requests will not only help the department, but they'll also help many of the employers as well. I will like to highlight a few of them for you. Senate Bill 485 requests changes to the definition of wages in order to align family definition with the definition used in unemployment insurance. This will make it easier for an employer to calculate wages, since it's the definition that they're familiar with. Number 2, FB 485 suggests the base periods for determining eligibility and calculating the benefit amount. These adjustments will allow the department to rely on the data it has already collected instead of requiring employers to supply supplemental information. And 3, 485 would provide the department with additional flexibility to approve employer-offered self-insured family plans, allowing them to set different financial solvency requirements for a large county versus a small business. Colleagues, I urge a favorable report for Senate Bill 485.
That was very fast, Senator Hayes. Thank you. And next we have, I guess, Secretary Wu. Thank you for waiting. We didn't expect that first bill to take so long. I appreciate your patience.
Of course, it was an important discussion. Thank you, Chair Bidle, Vice Chair Klausmeyer, and members of the committee. For the record, my name is Portia Wu. I'm the Secretary of Maryland Department of Labor. I'm joined by Regan Vaughn, our Policy Director of Family, and Dan Newberger, our Deputy Assistant Secretary of the Division. I want to thank Senator Hayes for his continued leadership and the committee for their hard work to bring paid family and medical leave to Maryland. The department's excited to build this program that will serve 180,000 employers and 2.8 million workers across our state. We're committed to building a lasting system that is responsive to the needs of workers and makes our state more competitive and also serves the needs of business. To build that system, we do need more time. As you are aware, when I came before you last year around this time, I just started, we didn't have budget or personnel to implement the program, even though it had been law for over a year. In the past 9 months, we've brought on a team, we've launched the work, but as you know, state procurement processes, especially working on IT, are not speedy. And of course, Maryland's law has unique characteristics that need to be taken into account. So some people say, well, just take what another state built, use that. It still needs to be revised for our laws because our laws are different. A key thing that this bill does would be to shift the start date of contributions when employers begin collecting funds back by 3 calendar quarters. So that new start date for payroll withholding would start on July 1st, 2025. That also means shifting back the start of benefits to July 2026. We recognize this is still a very aggressive timeline. Plenty of intervening factors could make it difficult for the department even to meet this timeline. However, we understand the charge the Assembly has given us to move as expeditiously as possible to provide those benefits. So we'll continue to press ahead. And also, as I've said in other cases, the work tends to expand to fill the time. So if we give ourselves 3 more years, we'll still be working on it. And we feel like what we need to do is set an aggressive timeline, try to meet it. SB 485 provides the department with the time and tools we need, and I respectfully request a favorable report.
Good afternoon, Madam Chair and members of the committee. My name is Regan Vaughn. I'm the Director of Policy for the Family Division at the Department of Labor. I'm here in support of SB 485. Over this past summer and fall, the division engaged in an intensive stakeholder engagement process where we held over 9 public meetings with over 1,000 attendees and put out 12 public documents for comment. The feedback we got resulted in the draft regulations that are currently posted on our website, again, for comment before we do the formal regulatory process. But throughout that engagement process and through conversations with our stakeholders, there were a number of areas flagged that it was either difficult to write the regulations for or small corrections and clarifications that we needed in the law in order to move forward. And it's that work that's reflected in SB 485. A few of those I'd like to highlight for you is first, we are asking for the authority to issue grants. We know we are going to need a robust outreach program in order to reach employers for compliance, but also to let employees know about the program. And we'd like to work with trusted community partners to be able to do that. We're also requesting the ability to charge fees if a private employer decides to opt out and apply for a private plan. We are funded through a trust fund. And if we do not charge fees for the evaluation and administration of those opt-outs, then it's the employees in the fund that are subsidizing the companies that are opting out. We are requesting a change to the definition of wages to comply to mirror unemployment insurance so that we can have some efficiencies there. And we're also asking for reasonable criteria when we evaluate self-insured plans. These changes will help with administration and ensure a smooth launch. I request a favorable report on 485. Thank you.
Madam Chair, that concludes our panel. Deputy Assistant Secretary Newberger is here to answer any questions.
Thank you. We do have some questions. Council just pointed out there's a few requests for amendments from the from MACO and MML. Have you seen those requests for amendments?
We have seen those requests. We have a meeting with them this afternoon to talk through it. We're aware of their concerns. I think it's going to be a policy decision on who covers the cost of administering private plans, whether it's those contributing to the funds or whether we're able to charge a nominal administrative fee when those applications come in to cover that cost on the department side.
So you'll get back to us after your meeting today and give us an update?
Yes,
Yes, ma'am.
Thank you. Do I have any questions for this panel? Senator Reedy?
Thank you, Madam Chair, and thank you all for being here. Secretary Wu, or probably anybody can answer this question. There's a couple of concerns I see with this. I mean, I know we had this really aggressive timeline rammed through in 2022, which, you know, we were, those of us that weren't going to vote for the bill were still concerned that we were kind of moving kind of a little too fast. So I understand the need to make some shifting in the dates, which makes sense. Can I start off with, I think, the rationale between letting the department file complaints, not just the employees. Obviously, Department of Labor oversees labor law in the state, and so it makes sense you would be able to file complaints against a business. But what happens with the complaint? Because now it's like you're filing complaints and you're investigating the complaint. So how do we make sure that there's a independent and fair process?
So I'll ask Regan to speak to it in more detail, but I do think one of the key points about the complaint process is, first of all, as you said, Senator, sometimes we may uncover something from UI or other context where we say, actually, this employer has not been following the law. I do think we also feel like administrative complaints processes can be more cost effective and less burdensome for all concerned compared to, say, litigation in a court. And so there's an important reason for the administrative processes. The idea is, and I think we're going to still flesh this out more in regulations, because we've gotten a lot of feedback saying we need to understand how this would work. We want to ensure that it's transparent and fair. And also, frankly, swift, because especially in the case of where there's a medical need or a time sensitive thing going on, we need to make sure there's a quick resolution for everyone. But can you say more about the process?
Yeah, I can talk a little bit about the process, which is required under the statute. Is once we receive the complaint, whether it's initiated by an employee or the department, we are required to conduct an investigation that includes mediation and discussion with the business. It's not an immediate action by the department. If the issue can't be resolved through mediation, then the department is able to issue an order.
What would the order look like? The order to pay, the order to provide the benefit, or?
It is actually required to describe the violation. If there are lost wages or damages, we can direct that those be paid. If an employee was not rehired under the job protection requirements, we could require reinstatement to the position. And there is the ability for civil penalty at the discretion of the secretary's designee. This entire process is also subject to the hearing and notice requirements under the state government article. So it can be appealed. We're required to follow all those regulations and
It's an appeal to like an ALJ. Is that what happens?
We are still working through the regulations on this piece, but there is the hearing requirement. And then, of course, any final order of the department can be appealed to circuit court.
And I wanted to bring up one other issue. I mean, the concern, the idea of issuing grants, are these going to come out of the funds that we're collecting from the employees and employers?
I can speak to that, Senator. So the idea is that the fund will pay for the administration of the program as well, right? That won't come from general funds. But the purpose of the grants, because, and we've reached out to the chamber and other organizations, is really based on some of our experience with paid sick and safe days, where a lot of people didn't know what the law was, especially a lot of smaller employers do not have their own HR person. And so they need assistance and information to understand what's coming. And especially, there is this required contribution. We published the rate last fall with the idea that people will have essentially almost 2 full years to prepare and plan in their business. But we know people are busy. They might not have heard or absorbed it. The idea of the grants is really to do that outreach and communication and assistance so people will understand the needs. We envision working with local chambers, local nonprofits, just to get the word out and provide the support.
Okay. And then in closing, just back to the one thing about the shifting the dates, we're not shifting. It's just going to be a year of people paying in before a benefit can be paid out, correct? Is that's unchanged though, right? We're just changing the dates.
We've adjusted it from 5 quarters to 4 quarters, and that's based on the 2 actuarial reports the department has seen that we believe the trust fund will be adequately funded to make that shift.
Yeah, I always had a lot of heartburn over you're gonna pay for a while before we give the benefit, but at the same time, we're trying to make it a self-funding thing. So, but it's actually good if we're shrinking a little bit. That's actually better than what we had before. Thank
And
you.
that's consistent with what we've seen in other states. That window has been adequate because of course we want to make sure the money's there.
Thank you.
Thank you.
Thank you, Madam Chair. Just one quick question. And going through this process, when will we know what the percentage will be for the withholding for the employee and what the payment will be for the employer?
So we actually published that last October, so it was 4 months ago. It's currently at 0.9%. So that's the combined. So if you recall, smaller businesses, the business does not pay half of it. They only withhold for the 0.45 from employees. For larger businesses, the combined is 0.9. Now employers can split that. They can also choose to cover the whole amount or cover more than the 0.4.
Is that 0.09 or 9%?
0.9, 0.9%, sorry.
0.9%.
Yeah, so less than 1%.
Less than 1%,
Yes.
okay. Thank you.
But to your point, Senator, we published it, but I know a lot of people maybe didn't pay attention to it. So we need to get the word out and really educate people. The law also requires the department to revisit this regularly with actuarial reports and data so we can continue to keep it updated to make sure the trust fund is adequately funded.
And the only thing that I'll add to Senator Reedy's point, having an opportunity to do that outreach and work with community-based organizations to get the word out is important. And one of the sticking points that I've had in conversations with the department. So I'm glad that they've made accommodations to do so.
See, any other questions for this panel? Thank you.
Thank you, Madam Chair.
Thank you very much. We have Lisa Klingemayer favorable, and then favorable with amendments, John Woolham's, Bill George, and Brianna January. Lisa, will you start when you're ready, please?
Thank you, Madam Chair and members of the committee. My name is Lisa Klingemayer. I'm the Executive Director of Maryland Rise, and I'm the Coalition Manager of the Time to Care Coalition. As this committee knows, a coalition of over 2,000 individuals and organizations who've been working to pass a paid family medical leave program since 2016. We're here in support of SB 485, and we're really excited to see this vision come to life over the next couple of years. We thank the department, we thank the General Assembly, this committee in particular, for your work on the Time to Care law, and we are really looking forward to the day that we can celebrate together, and we're in this for the long haul. To that point, just want to note, we recognize there is a delay in this legislation, and if I had magical abilities, I'd make this program operational today and folks can access it. I haven't figured out those magical abilities yet, and so recognizing the department needs a little bit more runway to get this plane off and running, we support that work. We're thankful to the family team, we're thankful to you all, and just want to say, again, we support the legislation and the work of this group, and we ask a favorable report on SB 485. Thank you.
Thank you, Lisa. Do we have any questions for Lisa? Favorable with amendment. Okay, so now we have favorable with amendments. Who would like to start?
Madam
Brianna?
Chair, Madam Vice Chair, esteemed committee, Brianna January with the Maryland Association of Counties in support of SB 485 with amendments. Committee, you will read in my written testimony that the only concerns that counties have with the bill language as drafted stem from the authorization to levy fees. With that said, we are extremely grateful to have a very strong working relationship with the department and in particular with the family division. You all should know that they have been fantastic to work with in the interim as we prepare to implement this benefit. And we are confident that we can get this bill language to a position in which local governments are comfortable. And as you heard, we have a working session right after this hearing to do just that. With that said, we thank this committee and the department for working with us. Thank you.
Thank you, Chair Beidle and members of the committee. Bill George with the Maryland Municipal League here today in support with amendment on Senate Bill 485. I won't belabor the point. My colleague from the counties has articulated the concerns that the Municipal League has as well, and it's around the administrative fee charged to those employers that seek an exemption from the state plan by offering a private plan to cover their employees to fulfill their obligations under the law. Throughout the debate over the past several years on this law, MML has hung our hat on having this exemption available to us. A lot of our members are seeking to take advantage of it. and the administrative fee. While hearing the rationale seems, not unreasonable, it was a bit out of the blue. We have had fantastic conversations, as Brianna mentioned, with the department over the interim and developing regulations. And we're happy to continue working with them to try and find a path forward. I understand that the department is maybe seeking a little bit of not leeway, but flexibility in terms of the language, how much that fee may be, how often the fee may be levied. But that same flexibility makes it very difficult as local governments to budget for this when we are seeking a private plan exemption. As you know, we work on a state mandated fiscal year with limited resources. And so we're happy to work with the department as mentioned this afternoon, and we'll be sure to let you know the results of those conversations. Thank you.
Thank you, Bill. And finally, John.
Madam Chair, Vice Chair, members of the committee, John Willems representing the Maryland Association of Boards of Education, here to support the bill with amendments, supporting the bill for the reasons articulated by the Secretary and Department, and to follow on the comments from my colleagues from MACo and MML. We did take to heart the exception for employer provided plans, and MABE led the effort to establish a collaborative that is now the MABE MACo MML collaborative, available to our county and municipal government partners and other local government entities. And that is to create cost savings. And so when you're doing a heavy lift to create a statewide collaborative to create cost savings, the specter of fees that could diminish those cost savings is of great concern. And so we are very interested in either being exempted from those fees as plans benefiting public sector employees. The public on public, fee gathering. It's the same taxpayers. It's the same. It's the same pocketbooks being tapped into. So we have that concern. But I would also raise that in public education world, we live in a world where fees were authorized to be collected from the state retirement agency, the state teacher retirement system. And those fees are per employee, and they are tens of millions of dollars a year. And so administrative fees, there's a range. And so $20 million or more a year in administrative fees that school systems pay to the state retirement agency is not a specter that we want to see come to fruition with regard to fees to administer the family leave program. And we have heard the intent of the fee described around a nominal fee, and we've also heard the fee described as something to achieve actuarial soundness of the program. Again, that's a broad spectrum of concern for us. Thank you.
Senator Washington.
Thank you, Madam Chair. Just to clarify, so if you do not, if you have your own program, then under this bill, they would provide, you'll have to pay a fee to the state. Is that right?
Correct. Basically, any employer that decides to not go with the default state program and the state fund would have to pay a fee. And
that includes governmental entities as well.
exactly. And it's unclear in the bill language. It just authorizes the department to levy fees. It does not specify the frequency nor the amount, such as a range that my colleague from MABE was just describing.
Got it. Okay. But they don't have to levy a fee if they don't want to. And under the bill, could they just already say that I don't want governmental entities under the current bill, or do you just want to make it clear that
they could by word of mouth in theory, but that is something that we would strongly advocate for in code.
Got it.
Obviously, that could change from one year to another, and yeah.
And so it says in the bill, it's in the pay family medical leave insurance. It says up to 12 weeks. So you all will provide up to 12 weeks as well if you had your own plan. Because I know it's not for teachers is not consistent across every county. Is that right?
Yes. So clearly, the compliance of school systems, county governments, municipal entities with this law is not changed in any way by this bill or by our request for an amendment related to the fee. We are all brought under the requirements of the new statewide family leave program.
Got it. Thank you.
Senator Reedy.
Thank you, Madam Chair. So yeah, on this fee issue, I guess I'm surprised. This is one thing I noticed also, and I'm glad you testified about it. Have we gotten any, and I did get to ask the department, so we checked probably offline, but why do we care? Why are we charging have you had any dialogue why Bill or Brianna, why they would charge a fee as long as you're providing what seems a little.
This, Senator, yeah, this was our philosophical issue, if you will, with the bill. In essence, it says that if you are following the law as written and passed
Right.
by either self-insuring or by contracting with a third party equal provider, you will be levied, there will be a fee levied against you to help basically cushion the state fund. In informal conversations that we've had, we've heard everything from basically this being buy-in from all employers if you're not going with the state plan, all the way to, as my colleague from MABE mentioned, making sure that the state fund is actually solvent, which is a little concerning.
Well, I mean, like, if I know, like, we let people opt out of Social Security at the federal level for certain reasons, but they don't get Social Security. So, I mean, I would think it's the same concept. Maybe there's a concern about people working for you for a while and then going to a private sector employer, but then they would just have to pay into the fund there. So I guess I'm not clear. Maybe we could talk about that. That's probably an offline conversation, but I think we ought to look at that, because I don't think it's, if the goal is to get people this coverage, then we ought to say, hey, if you can go to the private market, great. If not, you got to use the state state fund. Anyway, I'm sure we'll have a chance to talk about that offline. Thank you, Madam Chair.
Thank you very much. I have a couple quick questions. John, you spoke about the coalition MABE, MACO, and MML. Do you envision that you all buy one big plan, that you group together and buy one large plan, you know, all of you?
Would you like me to handle that?
Thank you.
Go right ahead.
Sorry, I've been working directly with MABE's executive director, not John, on the collab. So what we have done is we formed a public employee sector collab that consists of 21 out of 24 county governments, including, I believe at this point, all of the big 8, all 24 school systems, a couple dozen municipalities. For context, the amount of municipalities that qualify under family leave and actually have the amount of employees needed to provide the benefit are fewer. All 16 community colleges, as well as almost every local library system and regional center. Our goals with the collab is to basically pull together as these employers and to offer an RFP to the private market and basically see what folks come back with when it comes to managing this benefit, given our diverse employees and the amount of folks that we're looking to cover here. And then the members of the collab, they only have agreed to go to RFP together. They can then decide based on whatever plan the collab's advisory committee chooses, whether or not they want to actually purchase the insurance together to manage the benefit.
So Brianna, there's pretty much a standard set of what needs to be in the plan. You
Yes.
can do better than that, but you can't do less.
Absolutely.
So I think there's a lot of flexibility there. So in some ways, I understand why the administration would need a fee, because they're still going to have to make sure that you're doing the proper plan, that it's staying enforced, maybe handle complaints that might come from your clients, you know, your members. So I can kind of see both sides of that issue, but it would be interesting to see what comes back on your RFP.
We surely understand the overhead concerns of the department.
Well, thank you all for your testimony. I don't see any other questions for this panel. We have one unfavorable virtually. No, she's not virtual. Sarah Price is here in person. Unfavorable. Thank you.
Thank you, Madam Chair. Good afternoon, honorable members of the committee. My name is Sarah Price, here on behalf of the Maryland Retailers Alliance. Not here unfavorable on the program. We know everything's already passed. Not trying to take another bite of the apple here. I would say maybe neutral with amendments, if you would accept that position. We have a little bit of concern that Senator Reedy was alluding to with could be potentially problematic with a lack of oversight if the complaint process is all under one roof. we do also, it jumped out to us that in an effort to streamline the process, which we do appreciate the department trying to make this as smooth a transition as possible. We would prefer a little bit more flexibility for businesses that want to opt out for a private plan. This bill would remove the option to use a combination of self-insurance and a private plan, which sometimes might be the more appropriate option for a small business. So we just wanted to highlight that. We do also have some concern about the lack of detail around that assessment for the private plan. Madam Chair, I would agree with your perspective. I believe that the intention of the assessment is to cover basically the administrative cost of reviewing those plans. And as my organization often comes before you to talk about the burden of administrative costs, we do understand the department wanting to make sure that that is covered. I have some thoughts about a way to maybe mitigate that a little bit for businesses, which I will be reviewing with our legislative committee on Monday. So if our members are okay with my suggestions, I will be following up with the sponsors in the department with a potential amendment to proffer, but we need to cover it with members first. Thank you.
Thank you, Sarah. Do you have any questions for Sarah? Thank you for your testimony.
Thank you.
That ends the hearing on Senate Bill 485. Our next hearing is Senator Kramer, Senate Bill 600.
Look at that, Madam Chair. I cleared the room. Including you. All righty then.
With me now.
Well, good afternoon, Madam Chair, members of the committee. Ben Kramer here introducing Senate Bill 600, and not to be outdone by Senator Feldman, this is a 2-page study bill. So that's not going to happen. So colleagues, look, dental care is critically important. And for our seniors, having access to dental care and dentures can be life-altering. It has a direct impact on their ability to eat and get nutrition. It relates to their ability to vocalize, their self-esteem. It protects facial muscles from sagging when they have dentures, and it prevents wear and tear of remaining natural teeth. The bill before you simply directs the Maryland Department of Health to study the ability for dentists to make house calls and visit extended care facilities to provide dental care services and dentures to our seniors through the Maryland Healthy Smiles dental program. And it provides who the department will reach out to help give them guidance throughout the study and to ensure that the dental care providers are adequately compensated to ensure that they do in fact go out and provide these much needed services to our senior population. That's what the bill does, colleagues. And I hope we get a favorable report. And I have the great Dan Doherty, the man, the myth, the legend here to testify in support of the bill.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. I'm Dan Doherty here on behalf of the Maryland State Dental Association. I want to thank Senator Kramer for sponsoring this bill. He has been an advocate for the retirees and the elderly within his district. And I think he fully understands and has presented to you the need for proper dental care for this population. I would like to highlight a couple of things, however. 12 to 14% of Marylanders over 65 Significant number of these have medical complications, including cognitive disabilities. This requires that dentists travel to either their home, but in most cases, extended care facilities, assisted living. The reimbursement for that trip is under a code which is in my written testimony, and it amounts to about $15. They are reimbursed by Medicaid for one trip, even though they see 5 or 6 patients. So envision if the dentist is treating 5 patients who do not have these cognitive disabilities, but are mobily unable to leave and are living at home in an apartment complex, and they have 5 patients there, they get paid 5 times for that visit. If they go to the assisted living program, they only get paid once. So we're asking them to study reimbursing them for every patient they see. They have to take a lot of equipment and personnel. It is not an easy trip to make. With respect to the study of dentures and the need for it, Senator Kramer has covered that very well and completely, and I would urge that you give this bill a favorable report.
Okay, I don't see any other questions, but I have a question. I'm looking at the fiscal note. There's no fiscal note. Is this already included? Is it part of Medicare or Medicaid now?
No, but they can do it with their current staff.
Okay, great. I just was curious. Thank you.
And
I think
please,
it's
if I can
great.
remind the committee, there was no opposition. None. What other Kramer bill ever comes in?
You said it, we didn't say it. Thank you, Senator Kramer. Thank you, Dan. That ends the hearing on Senate Bill 600. Oh, I'm sorry, we have a virtual. I'm sorry. Dr. Charles Doring, right?
Yes, thank you, Madam Chair, Madam Vice Chair, members of the committee. Thank you for the opportunity to testify virtually here. Again, my name is Charles Doring. I'm a general dentist in Rockville, Maryland. I'm also on the Dean's faculty at our University School of Dentistry up in Baltimore, where I teach dental hygiene and dentists or future colleagues to provide care in long-term care facilities such as nursing homes, rehab hospitals. And I'm also a Maryland Medicaid dental provider within the state. And I can tell you, we do not get coverage for house calls. We do not have coverage for dentures. We can extract teeth, that is covered, but we cannot restore their smile. And I think those that testified before me, and there's no opposition to this bill, just want to remind everyone that the diseases we're talking about, dental decay and periodontal disease, are rather common. The Surgeon General has stated that up to 80% of our adults suffer periodontal or gum disease. And there is a connection between these diseases and the whole body connection. For example, heart disease, pneumonia, diabetes, and rheumatoid arthritis, which certainly affects our older patients. And then I have a course that I'm hosting coming up April 1st. And just to remind our legislators, don't forget to floss, and floss so you do not forget emerging evidence linking gum disease with dementia. So these are very, very important services that we can provide our patients that cannot come into our office, and also to add to their nutrition. For these reasons, I ask for a favorable report on Senate Bill 600. Thank you very much.
Thank you, Dr. Doring, for your testimony. Now, do I have any questions from the committee? Thank you very much. I think that is your fastest bill ever. Thank you.
Cha-ching.
Senator Kyle, let's see if you can beat this time. And do you have Brandon Floyd? Is he your panel?
Yes. Great.
Who's the other person at your table?
Nothing quite this bill yet.
I'm sorry.
Sorry. There's one more. Sorry. You
I
came up
only-
on the wrong bill.
Okay,
Thank
thank you.
Up next, yeah. All right. Good afternoon, Madam Chair, members of the committee. I'm here, Senator Don Gile here to present Senate Bill 412. Veterans and current service members frequently suffer from a wide range of mental health issues such as PTSD, anxiety, and depression, impacting not only the service member, but their family, community, and quality of life. Nationally, we lose 22 veterans a day to suicide, one veteran every 65 minutes. Providing effective behavioral health services for veterans and active duty service members is complicated by a myriad of factors: lack of providers with cultural competency to address the unique needs of veterans and service members, outsourcing of behavioral health services outside of the VA, and despite much progress, remaining institutional stigma within the service community. Veterans, service members, and their families are accessing behavioral health services from community providers, yet these groups are often overlooked in discussions that pertain to the provision and accessibility of mental health care and should have a voice with our local behavioral health authority. Senate Bill 412 is an important step to including military voices in important conversations on a local level, in line with the national effort to improve access and provision of behavioral and mental health care for service members and veterans. Under Maryland law, each county in the state must have a mental health advisory committee made up of professionals in various mental health care fields that ensures that resources are available to those in need and is charged with advocacy on their behalf. Currently, counties are required to choose set numbers of mental health professionals and other stakeholders from various fields listed in the establishing statute. However, consideration of veterans or current service members is not required. Senate Bill 412 alters the required makeup of each county's committee to ensure the consideration of individuals who have experience in mental health care for veterans or current service members. And including this perspective, the military community will have a greater voice in decisions that will have a positive impact on its members. Per the fiscal note, Senate Bill 412 would not result in greater state or local financial obligations. There was no opposition. And for these reasons, I respectfully request a favorable report on Senate Bill 412. Thank you, Madam Chair.
Senator and Brandon.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Brandon Floyd from the Maryland Hospital Association, here to support Senate Bill 412. This important bill adds representation for veterans and military personnel on county mental health advisory committees. Specifically, this legislation values the contribution of Maryland's veteran community and recognizes the unique behavioral health challenges they face. It is well documented our service members experience higher rates of behavioral health issues than the general population. Senate Bill 412 would make providers with experience in mental health, specifically for veterans or individuals serving in the military, eligible to serve on the Mental Health Advisory Committee. By adding these providers, the Mental Health Advisory Committee would benefit from and better serve the men and women who serve in our armed forces. Moreover, our hospital members and health systems are committed to increasing access to behavioral health services. True access means everyone gets a seat at the table, including Maryland's veterans. We truly value the service of military personnel and therefore recommend a favorable report on Senate Bill 412. Thank you.
Thank you, Brandon. And we have Lynn Nash virtually. Good afternoon. Lynn, please unmute.
Sorry.
Thank you.
Good afternoon, Madam Chair and members of the committee. Ditto. My name is Captain Lynn Nash. I'm a nurse, and I'm also part of the governor's challenge to reduce suicide here in Maryland. So you've heard all the good reasons why the statistics that Senator Gile included were broad. Here in Maryland, we had 620 suicides in 2021, of which 89 were veterans. Including a provider with experience with veterans healthcare on the committee, it just makes complete sense. This bill will cost no money. We have a number of active duty reservists, National Guard here in the state. They deserve our support and care. Please support this bill and thank you.
Thank you. Do I have any questions for the senator or this panel? Thank you very much.
Thank you, Madam Chair.
And Senator Guile, if you'll stay, you have Senate Bill 581, Public Utilities, Investor-Owned Utilities Prevailing Wage, 583. Did I say 581? I don't know where that came from.
Thanks.
All right. Good afternoon. Senator Dawn Guile again, District 33, here to present Senate Bill 583. The distribution system is the part of the energy grid that Maryland through the Public Service Commission regulates. How the distribution grid is planned and maintained will not only determine how reliable and resilient our energy system is, but also whether we can reach our clean energy and greenhouse gas reduction goals. With the passage of the Climate Solutions Now Act in 2022, we have plans for historic investments in our distribution grid to meet our climate goals. Electric line workers will be implementing these crucial improvements to the grid, and this bill will ensure that as we make the necessary investment in our grid, we are also building a strong middle class. Currently, Maryland law requires that all work done on underground utilities, gas and electric, is done with contractors paying prevailing wage. This bill simply would establish parity so that work done on all utilities above ground and underground will be done by contractors paying prevailing wage. Per the fiscal note, the Senate Bill 583 would not result in any greater state financial obligations. And for these reasons, I respectfully request a favorable report on Senate Bill 583. Thank you, Madam Chair.
Sorry, Michael Powers.
Yes. Yes, thank you. Dear Madam Chair, Vice Chair, members of the Finance Committee, and thank you, Senator Gao. My name is Michael Powers. I am Safety Coordinator of IBEW Local 70 here in Forestville, Maryland. I stand as a voice of 1,900 essential personnel, Local 70 members who tirelessly build, service, maintain our critical power grid and infrastructure. This bill, which mandates the prevailing wage for an investor-owned utility construction transmission lines facilities, is paramount for the welfare of our dedicated workers, their families, and the communities we serve. Prevailing wage ensures fair compensation, fostering economic stability and elevating a standard of living for those who maintain our critical infrastructure. I firmly believe that SB 583 will foster the creation and maintenance of jobs in this sector, ensuring fair compensation for skilled labor. Prevailing wages not only support workers and their families, but also contribute to overall growth and prosperity of our communities. By endorsing this bill, we pave the way for job opportunities that promote skill development, efficiency, and paramount safety. I believe that a favorable report on SB 583 is essential for the advancement of our workforce and the continued progress of our communities. And real quick, if I could hit on, with this bill, it would help to prevent the race to the bottom, help to keep the bad players out of the industry, you know, people that would be taking advantage of inexperienced, unskilled labor and winning low bids. I mean, so the prevention of the race to the bottom, you know, the lowest bid is not always the best bid. You know, safety and quality should matter, and it should matter in the state of Maryland. And one last point, in my name, Local 70, we are local labor, we ensure local labor.
Thank you. Do I have any questions for this panel? Senator Kramer?
Thank you, Madam Chair. I just want to quickly say that as the sponsor for the underground utilities prevailing wage bill, this is a good piece of legislation. And as you stated, sir, it does ensure that we are providing the best quality services on a very important public utility. And for that, I thank the bill sponsor. Good legislation. Thank you, Madam Chair.
I do have a question. I have an issue with a company in my district that got caught up in last year's House Bill 513 on the underground utilities. And because he had multi-year contracts with BGE, they're not adjusting the contract. So he's now paying unskilled labor, actually traffic control, $17 an hour, but because we've passed that bill, he has to pay them $24 an hour for 3 years. And BGE and other utility companies are not addressing the change in the law to help him with the contract.
Yeah. I agree, Madam Chair, that's unfair. Whatever was negotiated based on that existing contract is what should be on, operating under that existing contract with those terms. I would, be open to a clarifying amendment, just saying that this would not impact the existing contracts, it would be going forward.
Because I noticed.
Or it would require an adjustment to the,
I noticed in the introduction paragraph, it even this time says, and traffic control activities, which the prior bill last year did not say that. So we actually have a meeting set up, Senator Gao. Hopefully we can come to some agreement on
Be
that.
happy to do so, Madam Chair.
Yes, sir. You have.
Just in regards to traffic control, I know our contractors, our union contractors have used a strategy whereby which they utilize groundmen of higher skills and rotate them in. So there where the equity in pay is more equally dispersed. And that's, our contractors have been able to overcome some of those strains.
Thank you for that. Any other questions for this panel? We do have one favorable with amendment, Christian Johansson. Hi, nice to see you again.
Okay. Good afternoon, Chair Beidle, Vice Chair Klausmeyer, members of the committee. My name is Christian Johansson, and I'm Chairman of Stella May Contracting. We are an overhead and underground utility contractor. We're also a minority business enterprise business, and we are favorable of a prevailing wage in our industry. We do have some concerns, some of it been already raised, that we'd like to offer amendments on. And also referencing House Bill 513, we recently submitted a letter to Governor Moore with some of the issues we're having with implementation. We hope that Senate Bill 583 can not only be best practice for overhead, but could fix some of the issues associated with 513 going back. So there's two amendments. The first is really require Department of Labor to complete a comprehensive survey process for both above and below ground utility construction to get accurate prevailing wages for our industry, including all relevant skilled positions prior to the law going into effect. Spend the time on this. We've got to get it right. Include MBEs, include industry in this process, and allow us to provide feedback. Right now, we can't bid if we don't know what the prevailing wage is. And for HB 13, there's whole categories where there's no prevailing wages on the website. It's impossible to comply with the law. Second, clarify legislative language that existing contracts for underground and above ground prior to a certain date, which is ideally after we know what the wages are grandfathered and not subject to House Bill 513 and Senate Bill 583. We're having the same problems as the other contractor mentioned. We have long-term contracts. We know a lot of MBEs that have the same issue, and our wages may be going up, but we have no Department of Labor endorsed mechanism to charge for it. So please make sure that we don't suffer that harm. Thank you.
Before you leave, Mr. Johansson, you talk about last year's bill, House Bill 513, but it's effective March 5th of this year.
Yes, and part of what we're doing is we're communicating with administration, and we're trying to do our best to work through and make sure we have a pause on it. We don't know how we can comply if for all these skilled positions, there's no rates up. And that the survey's actually been done and we've been a part of the process and others have been a part of the process. And the second thing on the grandfather contract. So I think if there was action here with amendments, the administration might look favorably upon a solution that covers both bills.
Thank you.
We would hope.
Could you submit your requested amendment in writing for me, please?
We will. We'll submit a more detailed one.
But see, I'm only seeing oral testimony.
I think, Madam Chair, I think he just, it was more, what he had submitted was just more informal and a letter that was submitted. He just itemizes them. It's a letter that says, begin, there's this numeric. He has the number one requires DOL or Department of Labor. Number two, most importantly.
So you have some, because I only see Mr. Hansen's oral testimony, so I don't see that letter.
Okay.
We will
We'll-
submit it.
We'll get it.
Thank you very
Yep,
much.
take care of it. Thank
Do I
you.
have any other questions for this panel? In a different name, okay.
Okay.
With no other questions, that ends the hearing on Senate Bill
Okay.
583.
Thank you, Madam Chair.
Thank you.
Thank you.
Next, we have Senate Bill 648, Senator Ellis and Tom Clark. It's business regulation, contractors, subcontractors, and brokers, and Tom Clark's on your panel, and that's the only
Yes, Madam
witness I
Chair,
see.
he is on the panel call this morning. There was an emergency at one of his big job sites, so
Okay.
he won't be able to make it. But we have his testimony in the system.
Okay, great. Thank
And,
you.
So good afternoon, Madam Chair Bartle and Vice Chair Klausmeyer and members of the Finance Committee. I'm Senator Ellis, representing District 28, here presenting Senate Bill 648. Business regulation, contractors, subcontractors, and brokers prohibited conduct. This is simply a wage theft bill. Unlike the bill yesterday, no opposition, no drama, and we'll be over in 3 minutes. So the key is, we heard the testimony yesterday of individuals not paying their workers what they should. And we talked about lawsuits. Some happened in my own district in Charles County, where workers won hundreds of thousands of dollars in back wages. And the attorney yesterday talked about cases and case numbers, and I'm here to verify that actually did happen. Those cases were adjudicated. So there is a serious problem with wage theft in Maryland. This bill simply calls for a broker who supply these workers and is integral in the system that perpetuate wage theft. If they are found guilty of any, and these are the terms I have to make sure I get it right. If they are guilty of any malfeasance, misfeasance, or nonfeasance, they are automatically banned from being a labor broker for 5 years. And so it doesn't have to be a criminal offense. If they are found guilty of malfeasance, which is an act that is illegal and causes physical or monetary harm to someone else. Misfeasance refers to the improper performance of a lawful act, resulting in harm, injury to another person or entity. And nonfeasance, I had to look up that one, is the omission to perform a required duty or the failure to act when a duty to act existed. And so no matter what they claim, whether they knew or not, if they provide workers for these contractors and their wages were not paid and they're found liable, that broker is banned from doing business with any contractor in the state of Maryland. I just want to say that Mr. Clark, who was supposed to be here but unable to be here because of emergency on his job site, who is the political director for IBEW, International Brotherhood of Electrical Workers, number 26, support this bill. And he says, the problem of wage theft is an ever-growing problem in Maryland. It affects the immigrant community a lot and those underrepresented in the construction field. And so he asks for your support. And the second individual who couldn't show up, Congressman David Trone, he gave a testimony and it's written in your system. He's talking about wage theft is one of the most challenging obstacles that many workers in Maryland, especially those in the building trades industry, face every single day. The congressman go on to say there is an estimated $60 million in wage theft yearly in Maryland, and tactics can vary. Theft can look as simple as failing to pay minimum wage, prevailing wage, or overtime, or as complex as misclassifying workers based on the type of work that they complete. The congressman go on to say there is no question. Those who engage in wage theft are stealing money from the pockets of their workers, period. This issue is far more widespread in Maryland than it should be, and is one that must be rectified immediately for the sake of all Marylanders. Therefore, Senate Bill 648 moves Maryland forward by prohibiting a person from serving or acting as a broker between a contractor and a subcontractor during the 5-year period immediately following the date the person was convicted of an offense constituting criminal malfeasance, misfeasance, or nonfeasance under any federal or state law. And he goes to conclude that it's my hope that by creating meaningful sanctions for bad actors in Maryland, they will be encouraged to think twice before stealing from their hardworking employees and committing other criminal offenses as an employer. And if those bad actors ignore this new legislation, continue to work in bad faith, then there is no place for them in the state of Maryland. We'll continue to move forward and build without them. So, Madam Chair and committee members, I ask for a favorable report on Senate Bill 648.
Thank you, Senator Ellis. Do I have any questions for the sponsor of Senate Bill 648? I do not see any questions. Thank you, Senator. That ends the hearing on Senate Bill 648. And next we will go to your bill, Senate Bill 647, Abandoned Cemeteries Fund, Establishment and Income Tax Checkoff. Senator Ellis, you have a panel, Eleanor Thompson from the Charles County Commissioners, John Dove, a Charles County Commissioner, Jean Bailey, PhD, and then you have a virtual. Well, I don't know if she's the panel. Deborah Rapazzo is your virtual.
Yes,
Thank
panel,
you.
come forward, please. And yeah, thank you. Technically, you're correct with the names, Madam Chair, except that Commissioner Dove is not a Charles County Commissioner. He's a commissioner of the Department of Labor.
Yes.
In charge of
Occupational professional licensing.
occupational professional licenses.
I do know Commissioner Dove and
Yeah.
threw me off when I saw Charles County Commissioner. Thank you.
Yeah, so, and then Ms. Thompson also, she was put as a Charles County Commissioner. She's a commissioner on the Maryland Commission on African American History and Culture. I don't know what happened, but I'm so happy they're here. So Madam Chair and Vice Chair and members of the Finance Committee, I'm here to present Senate Bill 647, which is Abandoned Cemeteries Fund to establish an income tax checkoff. This bill establishes the fund to provide for the care, preservation, maintenance, and restoration of abandoned cemeteries in the state, and establish a certain income tax checkoff for voluntary contributions to the abandoned cemetery fund. It requires the controller to include a checkoff on individual tax returns forms for voluntary contributions to the fund, and to include certain information in each individual income tax return package. As a veteran, I often go to veteran cemeteries for ceremonies. Well, you know, but Arlington, even here in Annapolis, right downtown, close to Westin Hotel, there is a veteran cemetery, and across the street from that veteran cemetery is a civilian cemetery. The veteran cemetery is so well kept. It's neat, or the grass is always cut. It's, you know, the trees are taken care of. And then I look across the way, and the civilian cemetery is not that well kept. And there are cemeteries across the state that are abandoned. Just abandoned, whether the group that was formed 200 years ago to take care of it, well, disbanded, or they lost the state permit to function as a group. But a lot of these cemeteries are abandoned. And this bill, the administration came to me with idea for this bill as a companion to another bill that was heard in another committee in the JPR, as a matter of fact, on the cemeteries for the formerly enslaved on private property. They exist all over Maryland. They're ignored, and we're trying to really make sure that these areas of high interest for the population are taken care of. You know, so many cultures, they maintain a relationship with the ancestors. It's not like they're gone and forgotten, whether orally, and people visit these sites, and it's connects us with our ancestors, these cemeteries. And we want to make sure that when we pass this bills, and I pray that we do a favorable report on the Senate Bill 647, we can really work hard to upgrade these cemeteries, to plant trees, to make sure the hedges and everything is taken care of so that we can really maintain the connections that so many of us have with our ancestors. And I want to thank you for your attention on this Friday afternoon and ask for a favorable report on Senate Bill 647.
Thank you, Senator. Who would like to go next?
I'll be happy to start.
Thank you, John.
So for the record, my name is John Dove. I'm the Commissioner of Occupational Professional Licensing at the Maryland Department of Labor. Online with me is Debbie Rapazzo, who is our Executive Director for the Office of Cemetery Oversight. She's here to answer any questions that you may have. I'd like to thank Chair Beidel and all the Finance Committee members for allowing me to introduce you to SB 647, entitled Office of Cemetery Oversight Abandoned Cemetery Fund. I'd like to explain why this passing of this bill will benefit the citizens of Maryland. This bill will create a fund to restore and maintain cemeteries that for any number of reasons have fallen into disrepair. The Department of Labor will oversee the fund and the upkeep for cemeteries that have deteriorated due to abandonment and neglect. Taxpayers will be able to make donations to the fund through their state income taxes through a prompt asking for a $1 donation. These donations will be placed in the abandoned cemetery fund and will then be used to administer the fund and pay for the maintenance of abandoned cemeteries. The bill will continue to enhance the partnership between the Office of Cemetery Oversight and the Department of Public Safety and Correctional Services by utilizing teams of incarcerated persons to perform horticulture and restoration activities, providing skills and training for employment for inmates, as well as allowing the OCO to create new partnerships with small business. Will also be utilized in other death care organizations around the state. And we do pay the inmates. I want to make sure that is documented. Also, by passing SB 647, residents of Maryland, past and current, will be reassured that many abandoned cemeteries will be cared for, and the individuals buried there will finally be treated with respect. Thank you for your time, and we ask for a favorable report. Thank you.
Good afternoon, Madam Chair. My name is Eleanor Thompson. I'm a genealogist, historian, author, and one of Maryland Commissioners on African American History and Culture. I represent Anne Arundel County and the Ancestral Remains Committees. I've also worked on Maryland Historical Trust project with documentation of historic cemeteries, and I've worked with the Office of Cemetery Oversight. I'm in favor of this bill because often what happens is when the slave trade was going on, numerous sites for slaves in the import and deporting of these sites, people passed away. So they were buried at unknown places. Now we have, because of urban renewal that has came around, there are unknown cemeteries all across the state of Maryland. And it's important that we know as African Americans, just not African Americans, that we'll be here for a certain period of time. We won't always be here, but we want to make sure that our ancestors have a proper burial and dignity at these sacred spaces that we have. So therefore, in the last, to piggyback off the last Bill 105, House Bill 105, there was London Gould who helped to free the slaves on the Maryland's Eastern Shore. He's buried over in a cemetery that their family can't access. Having these funds to help maintain some of these African-American cemeteries that we do not know about is very important. It allows people to honor their loved ones who came before this generation, to allow them to know exactly where they're interred at. I'm in favor for this bill.
Thank you. And one more, Jean Bailey.
Yes, good afternoon. My name is Jean Bailey, and I am a professor at Howard University and president and CEO of the Sister States of Maryland, Inc. I am also the project director for a major project exploring cultural linkages between Black Marylanders and civil rights movements abroad. As part of this project, we're collaborating with the Port Marcus Project In the 30th anniversary of the UNESCO Routes of Enslaved Peoples, to memorialize the ports of entry of enslaved peoples into Maryland. For your information, by 1755, 40% of the 130,000 inhabitants of Maryland were enslaved. So you can imagine that many of the abandoned cemeteries have the remains of enslaved peoples. Enslavement was one of the greatest atrocities and the longest and most extensive genocide in human history. In addition to the physical harm and psychological harm and the inhumane treatment, it's caused dehumanization, etc. And also ongoing racism. To eradicate the racism, it is necessary to have a process of healing and be prepared to act on approaches to healing. One is through honoring and remembering our past, as in the preservation of the burial grounds of enslaved peoples. I have one new burial ground that has just been enacted in Silver Spring, Maryland, in Chevy Chase, our most prestigious neighborhood, is in Rolling Wood, Maryland. Thank you.
Thank you. Deborah, do you want to add anything to this panel?
Chair and all the other members of the Finance Committee, I hope that you are favorable in your decision in passing this bill. The Office of Cemetery Oversight has worked with the Department of Corrections to utilize inmates in going out on some of like a pilot program to help maintain some cemeteries. And so we've gotten this down really well. We've also created a pilot training program where we went into the facilities and had a trainer there as well, and put these gentlemen through 6 to 8 weeks of training on restoration work and learning all about cemeteries to prepare them with their already added skills of horticulture to go out and help maintain cemeteries, abandoned cemeteries. But this project isn't just going to be a one-time thing. We have to encompass the whole state of Maryland, the 24 counties, the city of Baltimore, and different death care industries, that groups that are out there helping to maintain these graves that sometimes are forgotten, and they should never be forgotten. I don't know who the author is, but they say that how we maintain our graves through our state is what people think of us. And you know what? I want to change our opinion and help our Marylanders be proud and provide the respect that these families and the individuals that are interred in our grounds should deserve. So I look for a favorable decision and the help of all Marylanders in this as well. Thank you.
Thank you, Deborah. And I see a question from Senator Washington.
Thank you, Madam Chair. Great bill. Thank you, Senator, for bringing this bill to us. I have a question about is it just for abandoned cemeteries, or is this for any cemeteries that are unkept?
Abandoned cemeteries. This is strictly abandoned cemeteries. When we find a cemetery is unkept, when we get a complaint from a legislator such as yourself, we actually track and try to find out who actually owns it, and we try to hold them accountable to actually taking care of the cemetery. If we can't find that person, it either falls back to the county, or we try to arrange help to help get that cemetery back into repair.
Okay, I just don't know the answer to this, but our cemeteries, they're not publicly owned land, right? Is that right?
They are not. So you have corporately owned cemeteries, you have religious cemeteries, nonprofit that we don't actually oversee. We help them as much as we can. And then you have veteran cemeteries, which the good senator spoke about, and those are absolutely kept in great repair by the.
Of course, I've stayed at the Westin, so I've seen that cemetery a lot in pristine condition. How many abandoned cemeteries do we have here in the state?
We don't have a number for that. As we get calls, we try to handle them and get them, but we do not have a.
Do you keep track of how many? So do you keep track of how many you went out there to see so far?
Debbie Rapaza, you have a question? Can you answer that?
I can tell you that we have a cemetery inventory listing of almost 5,600 cemeteries. And they're broken down in different categories. And the two biggest categories that probably, or maybe the one biggest, would be our family-owned cemeteries, such as individual families lived in an area and they put a cemetery in their backyard. Some of those families have moved on. And between that and some of our religious groups, maybe the religious entity has disbanded, and unfortunately, the land becomes abandoned. And so does that cemetery that was with that, which, you know, is so sad, but that happens a lot. Or some of the records don't match up with what some of these facilities believe that they don't own these type of cemeteries. So we try to decipher all that, put it all together. And this bill would be so positive to give us the funds that we need to go out to help, where volunteers can only help, you know, today.
Yeah.
So I would say,
We don't
you
have
know,
a number.
yeah, a number would probably be, I mean,
maybe part of the
calls
bill
every
is
day
to,
on these.
thank you. Maybe part of the bill is to collect that data of how many there
Yes.
are and make sure we keep track of them and where they are. And last question, Madam Chair, is about the ones that are abandoned. Do you, is there a possibility for eminent domain? Can the state take over these? Like, what's the process if they're just completely abandoned and you can't find anyone to take over the property? Is there a process for the state to take over it or the county to take over it?
I don't know that law. We'd have to ask an attorney on that. That does not fall in our purview by any.
Don't worry about it. Thank you very much. Great.
And could I just add, Senator, that's part of the Senate Bill 105 being heard in the JPR committee. And those questions came up there, some constitutional issues. And so we're working through those right as we speak.
For Mr. Dove, I have in my district a yard. It belongs to, well, it's got a house, and in the backyard is a cemetery. And I don't know who's buried there, but they were a couple of community members came and said to me, we have to do something because the woman is getting elderly, and if she passes, well, when she passes, somebody's got to take care of that cemetery. So do you have any ideas about, could that be on your list of places to take care of?
Crossmark, can I have Debbie answer that question for you?
Okay.
Absolutely. Sometimes the new owner, I mean, of course, the land already has the cemetery in the land. So the property would be sold, the new owners would have it, but it doesn't always mean that the new owner is going to take care of it or even allow family members of the decedents to come in to visit. But if it is considered and they don't want anything to do with it, it's considered abandoned. We would look into that and make sure that, you know, possibly we can take care of it or go out occasionally and do some cutting and get some volunteers out there. But it would also have to be with laws looking at the egress and ingress situation.
Okay, thank you. I may be in touch then. Good.
Okay, great. Thank you.
Yes, ma'am.
I do want to mention there's a project in my district that Commissioner Dove knows well. And it's one of our local churches, and they've gotten St. Mark's, and they've gotten some local development council funding and are maintaining. It's taken a long time. It's all volunteers, but they are actually renovating an old cemetery. So they're just doing a lot of work, and it's great.
Yes,
we
and
don't
thank you.
take
Thank you.
questions back. I'm sorry, it's not the process, but thank you. So I have no other questions. Thank you for this. It's very interesting. I think a lot of questions arose, but thank you for your testimony.
Thank you.
And that ends the hearing on Senate Bill 647. And now we will go to Senate Bill 516, and that's Senator Washington. And you are the last bill for the day and the last bill for the week.
Friday. It's Friday night.
Thank you, Madam Chair. Members of the committee, for the record, Senator Alonzo Washington here to introduce Senate Bill 516 to the committee. Madam Chair, I do have some folks on my sponsor panel that I'd like to bring up.
Georgie Brophy, David Miller, Michael Barton, and if Keith Cleveland wants to come up. And Madam Chair, Bruce Bariano, unfortunately was not able to sign up because his office had a death in the family. So I was wondering if you can give him a personal privilege to be able to say a couple words, if you don't mind. That's totally up to you. There we go. Okay. Thank you, Madam Chair. First, I just want to say thank you to the committee for having me here today. It was over just about a year ago when this panel of folks that are here met with me in my office to discuss aerospace and technology and NASA in the state of Maryland. They came to me and said that we need to do more about aerospace here in the state of Maryland. And I said, man, that sounds great. You're absolutely right. We should do more in aerospace here in the state of Maryland. And I don't think they knew that how ambitious I was, that I would take that and say, let's create a bill or a commission to get this thing done. But then since then, I created my own summer study where I wanted to make sure that we worked with the local businesses, the Maryland Commerce Department, local government, NASA, NOAA, and anyone else that would be interested in making sure that we build aerospace here in the state. So during that time, I conducted a bunch of research, and what I found is that Maryland is being left behind in the aerospace community right now. In Texas, they've just ordered they're using state dollars to invest around their NASA facilities, almost to the tune of $200 to $300 million. And they recently passed legislation similar to the one that you have in front of you that I'll go over in a second. Virginia is ahead of us in this aerospace industry right now. Florida is ahead of us, and we've seen it constantly many times. And all of that to say that we have the resources here in the state of Maryland, but we don't have a strategy. We don't have a strategy. The governor says, and he said this just last year, that here in the state of Maryland, we are resource rich, but strategy poor. And so that's why I introduced SB 516, which will create the first ever Maryland Aerospace and Technology Commission to promote innovation in space exploration and commercial aerospace opportunities. The commission will identify research opportunities for the state and help fund them while assisting in the development of the industry. The bill also provides for the creation of the Maryland Aerospace Research and Space Economy Collaborative, very long name, but great collaborative, which would advise the commissions and promote partnerships with the local community. That includes places like NASA Goddard, Wallops, and other places around the state. The collaborative will develop plans to improve the physical infrastructure surrounding NOAA headquarters, the Goddard Space Flight Center, as well as University of Maryland College Park, and we're open to amendments for other areas as well. Finally, the proposal asks for the creation of the Maryland Aerospace and Technology Fund, which will help carry out the goals of the commission. The goal of this bill and the goal of the commission is to provide state-level attention and support to this industry. The MATC is needed to facilitate collaboration between government, academia, and industry to advance Maryland's aerospace technologies and leadership. Additionally, this legislation further supports the development of a technology corridor in Maryland to support the federal efforts to increase the understanding of Earth and research and development initiatives leading to technological advancements and STEM curiosity in our students. I think, as all of you know, we also were, we won the FBI in Greenbelt. And actually NOAA is at NASA, is also in Greenbelt. So this is even more important because of that recent win that we had. In addition, it also is important to note that although the fiscal note on this bill initially cost $1.5 million and $5 million thereafter, we did not put any of that in here in this bill to request the $5 million or to request the $1.5 million. We want to create this commission because we want to get it jump started first, to put everything's in place to make sure that we can create a synergy within the state and aerospace community. And so we didn't ask for those dollars. I don't know where that came from. So let me just make that clear. To summarize, these measures will help prevent the state of Maryland from falling behind other states to commit to similar investments. We are the only state that has a spaceport, but has not created the legislation and partnerships to support it. And this bill will help change that. To summarize, this commission's mission is to increase investment activity in Maryland's aerospace ecosystem, accelerate innovation in commercial aerospace applications, enable statewide industry growth, train the next generation of aerospace scientists, engineers, and other personnel, and improve the physical infrastructure surrounding the centers
of the aerospace industry. Madam Chair and members of this committee, for these reasons, I ask for a favorable report on Senate Bill 516. Thank you.
Thank you, Senator. So who would like to go next?
Hello, Chairwoman, Vice Chair, and members of the Finance Committee. My name is Georgianne Brophy. I'm an aerospace engineer and I'm a business executive with a woman-owned small business. And for the past 35 years, I've lived and worked in the state of Maryland in the industry in both large businesses and small businesses. I'm also the co-founder of the Maryland Aerospace Alliance. I'm a director and officer on the Maryland Space Business Roundtable, and I'm a member of the Goddard Contractors Association. Most importantly, I have a daughter who's a junior in high school, and her dream in Montgomery County, and her dream is to become an aerospace engineer at the University of Maryland, to graduate, to do data analytics and machine learning on aerospace data in the state of Maryland. And I want her to have a job. She wants to have a job in the state of Maryland. So that to me is passion. And we are at a risk for not having those jobs in the near future. Maryland has enjoyed a robust history of aerospace being federally funded. And that is how we've become an aerospace state. It's extraordinary, and it's across the state. So this is across counties, Montgomery County, PG County, St. Mary's County, Worcester County. It's across the state that we have aerospace. And what we need moving forward, this commission will basically form this group that the senator spoke about that will help advise and invest money into the state when federal funding has become so limited that could really impact us. And what we're going to see is a bleed of companies leaving our state to those other states the senator mentioned who have very aerospace friendly state investments. With that bleeding of large and small companies going, so will those exciting, inspirational jobs for early career, professionals and people from our higher education schools in the state of Maryland. They'll go elsewhere. So we are so excited about the development of this commission. We very much ask you to vote favorably for it. And thank you so much for your time today.
Good afternoon, Chair, Chairwoman, and Vice Chair, and members of the Senate Finance Committee. My name is Michael Barton, and I've been working for a small business in aerospace in Lanham for over 10 years. And I'm also the other co-founder of the Maryland Aerospace Alliance. I'm also the Vice Chair of Public Policy for the American Institute of Aeronautics and Astronautics here in the region. Maryland, if you don't know, has been an anchor of American aerospace since the very beginning. In 1909, the Wright brothers taught the first U.S. military pilots how to fly in the oldest airport in the world, College Park Airport. Today, Maryland has the most federal R&D spending in the U.S., twice as many federal labs as any other state. We don't hear about it much, but almost 10,000 aerospace companies call Maryland home today, and Maryland has the highest concentration of aerospace engineers in the country. Whether that's exploring the universe for space telescopes, understanding how our climate is changing with Earth science data, or preparing for a future of autonomous aviation, over 140,000 aerospace workers contributing almost $1 billion in tax revenue in Maryland are continuing to set the tone for our nation's aerospace endeavors. I moved to Maryland to work on these things, and I've been volunteering my time to speak on our behalf on Capitol Hill. And we co-founded the Aerospace Alliance because we need your help. These other states, as they've said, are trying to take away these capabilities. We need an organization that pulls all the stakeholders together, that funds initiatives to maximize the impact of federal and commercial investment. We need an organization that better connects our ever-changing industry with our educational system to ensure that our workforce reflects the diversity of our state and is prepared to meet the challenges of new technologies like machine learning, like AI, augmented reality, and model-based systems engineering. We also need to advertise to potential employers and employees that Maryland is an aerospace state. Maryland Aerospace and Technology Commission will do all of these things. So we ask you to support.
Thank you for your testimony. Who's next?
Chairwoman Beidel, Vice Chair Klausmeyer, and members of the committee. My name is David Miller. I'm an aerospace engineer, born and raised in Howard County on a farm out there. I've spent most of my career here in Maryland in the aerospace industry in both small and large businesses. I'm also the Vice President and Chief Operating Officer of Merck Aerospace, a woman-owned small business in the state, which does business for Goddard Space Flight Center, Applied Physics Lab, and Aberdeen, as well as other NASA centers. The major federal budget cuts being proposed and enacted will have a devastating impact, not only on small and large businesses, it also has a symbiotic impact on Maryland's ability to attract and develop high-tech workers that contribute to the current tax revenue base. Without robust federal funding and the tip of the spear that represents, those private sector jobs will cease to exist, and with it, the revenue base that Maryland has come to rely on. This also goes into the manufacturing sector as well. It's key. I consider the manufacturing sector to be linked to this topic as well. And we need to bump up the number of manufacturers in Maryland. The growth of any national, state, and local economy is predicated on a robust research and development sector and the technologies created by those activities of those individuals employed. These technologies that they create are then spun off into the private sector of Maryland and our nation, creating a depth of new feeder industries that also contribute to making our business sector more productive and more attractive to foreign partnerships and investment opportunities. This economic engine starts with federal funding. This multiplier effect has profound impacts, as has been reported many times in the past. Chase Econometrics conducted a study and found that for every dollar that NASA spends in their budgets, more than $10 are returned to the private sector. Pretty good investment. An example today can be seen with SpaceX rocket systems as they have their origin in federally funded developments of NASA in the 1960s and the rocket technologies they now employ and have further developed. This science-driven ecosystem is good for every township in the state of Maryland and beyond. Without the science and technology-driven budget priorities at the federal level, the economic opportunities for the state of Maryland and its citizens will stagnate. This reduction will also create job losses, reductions in tax revenue base, decreased investments, and major downward pressure on the housing market.
David, your time is up. Will you please just wrap up?
We would like for the state of Maryland to have its voice heard in this and this trend and the claim of economic rights to all Marylanders. But without protecting the R&D sector in Maryland and the federal funding that fuels it, economic growth and the multiplier that goes with it is in jeopardy. We would please like you to vote favorably for the bill SB 0516. Thank you.
And then I think Mr. Keith Cleveland.
Yes, thank
Thank
you, Madam Chairman, committee members. So I'm born and raised in Howard County, Maryland. My father worked at NASA Goddard from 1980 to 2007. So I'm a second generation aerospace engineer. Currently, I am the general manager and CEO of Cleveland Aerospace Technology Services with my wife. And one of the things that I wanted to bring up is that I had the privilege of working on such projects as the James Webb Space Telescope, the Lunar Reconnaissance Orbiter, the Lunar Orbital Laser Altimeter, and the Roman Space Telescope, which is currently under production. So those are all things that happened in the state of Maryland. Those are all amazing things that are affecting not only the state, not only the country, but also the universe as we know it. One of the things that I want to encourage my kids, as well as my father encouraged me, is to embrace technology, exploration, and seeing what humans can do with technology for exploring space. One of the things that my son is currently doing at South River High School, one of the wonderful programs here in the state of Maryland through Anne Arundel County Public Schools, is working on a solar array powered car that they're going to have a competition for. So I'd like him to be able to use those skills that he learned in high school to be able to take that to higher education and come back to the state of Maryland to possibly, if he chooses without some intervention from me, to be an aerospace engineer, and also for my daughters to have that opportunity here. We are the #1 state when it comes to aerospace engineering. It has been said many times before, there's 140,000 aerospace engineers, related employees here in the state of Maryland. And this commission will ensure that we'll be able to keep that here and utilize the federal funding and possibly future state funding to enable the future generations to come to the state of Maryland so that we can further our advancement of knowledge for the human race. Thank you.
Mr. Mariano.
Thank you, Madam Chair. Thank you for your courtesy and understanding, and thank you, Senator, for introducing this bill. For the record, Bruce Bariano, I'm here on behalf of the County Commissioners in St. Mary's County, favorable with amendments. It's a fabulous bill. It's so very much needed. I will be presenting an amendment. I have shared it with the sponsor and also on the House side to include representatives of St. Mary's County, really Patuxent Air Center. Patuxent is the Navy's busiest flight test center in the world, right here in our state in Southern Maryland, St. Mary's County. The host of the Naval Air Systems Command and the Naval Air Warfare Center Aircraft Division. St. Mary's County, with these airspace facilities, provides over $6.2 billion to the economy of the state of Maryland. And it's the third largest workforce, over 52,000 employees working or directly related to these facilities in St. Mary's County here in the state of Maryland. I would just say, picking up what the senator said, that the bill does not mandate any funding or anything like that. I would fully agree. It's so critically important. Just get the commission up and running so it can get started and it can really develop and improve airspace, the industry. Thank you very much. Urge a favorable report. And again, thank you for your courtesy.
Thank you,
and
Mr.
understanding.
Bariano.
Madam Chair, one quick comment. One, there's no opposition to this bill at all. The Department of Commerce did send in a letter of support for the legislation as well. And part of the commission's goal is to make sure the aerospace community is a great community here, but to make sure it's more diverse as well, which will be part of the goals of the commission. So I just wanted to note that. Thank you, Madam Chair.
Do you know what's really interesting on your committee testimony? You have a whole bunch of people unfavorable that didn't submit any testimony. They just called in and said unfavorable, and I've never seen that many. I can't.
I've seen that on a lot of other folks' bills too, that they
Yeah.
just say unfavorable and it says no, it says
Right.
some person's name and then that's it.
Well, look at yours. I don't know what it's about. Senator Gall, you had a question?
Thank you, Madam Chair. Thank you, Senator, for the bill. And I wanted to also, as a point of privilege, to extend my welcome and thanks to Mr. Cleveland for his testimony. Not only is he a rocket scientist, but his business operates in Davidsonville, Maryland, which is located in District 33. And I thank him for for him bringing industry to my district and also to the state. And thank you all for your testimony. Thank you, Madam Chair.
Thank you. That's interesting. Do we have any other questions for this panel? I have a few virtual people. No, thank you for bringing the bill, Senator.
Thank you.
So we're going to have Dennis Furick is favorable on a virtual call. Dennis, unmute, please.
Okay, can you hear me, Madam Chairman?
I can, thank you.
Great. Well, good afternoon, Chairwoman, Vice Chair, members of the Finance Committee. Thanks for the invite, Senator Washington. My name is Dennis Farrick. I volunteer as the Maryland Space Business Roundtable President, and appreciate being able to testify in home in my sneakers and sweatpants. My aerospace career myself includes all the following in Maryland. I've worked with Fort Meade on future technologies. I was stationed in Silver Spring as an Air Force officer, assigned to NOAA. I worked for a commercial space software company in Lanham, where I supported personally Pax River, kick the tires on the Global Hawk, Army Research Lab, Aberdeen Proving Ground, Wallops, stayed in Maryland, working Wallops, APL, Goddard, as well as large and small commercial firms. I partnered with universities from my Columbia and Greenbelt offices supporting NASA's engineering, IT, science, and emerging technologies. So Maryland really is a place for space, and we need everyone to know that. So the impact on the global market, it's an $80 billion government investment. Worldwide, it's a $500 billion global market in space, growing to $1 trillion. Others have quantified the impact to Maryland, but I just got to reiterate, we are number one in federal R&D, contributing over $1 billion to the state through tax dollars. And again, the successes include modern rocketry, flying Parker Solar Probe into the sun, building James Webb Space Telescope, highest concentration of Earth scientists everywhere, and competing in the war for talent, keeping the great schools from Maryland's scholars in Maryland after graduation. I do want to reiterate Senator Washington's comments about competition. Space Florida has invested through its Aerospace Finance and Development Authority over $5.5 billion in statewide capital investments in 151 projects, billions. Texas Space Commission just stood up this past legislative session, allocated $350 million in taxpayer fund, developing the space industry in Texas. Outside of JSC, A&M is invested there. And to wrap up, we just need to coalesce as a community to understand the impact, build the strategies, and it'll have an enormous ROI for the state. Thank you for your support of this critical step to continue a great legacy for Maryland's aerospace community.
Next, we have Belay Demose, I think from University UMBC, correct?
Yes, can you hear me, Madam Chair?
We can hear you. Thank you.
Yeah, thank you very much for this opportunity to testify. My name is Belay Demose, professor at UMBC and a leader in the two large cooperative centers with NASA, as well as the director of a NASA UMBC Howard collaboration at Beltsville, Maryland, that studies climate change. I am a member of the Maryland Climate Change Commission and the science steering working group. I am in favor of this amendment, SB 516, because I live in Maryland and my daughters want to study aerospace engineering, both of them. Maryland leads the nation in employees in this area, and it's home to both NASA and the NOAA centers. UMBC should be part of this commission because UMBC is efficient in business administration in the centers, is known by NASA and NOAA. We've got a large collaboration that started in early 95 with both of them. And in fact, our collaboration with the HBCU at Howard at the Beltsville campus leads in diversifying NOAA's employment force. We've graduated 54% of the African-American PhDs in this field. Serving on the board of this commission, together with our partners, is important for the state, NASA, NOAA, and UMBC. I am happy to support this House bill, and Maryland Aerospace and Technology Commission is a no-brainer for the state. I strongly believe that UMBC should have a place on it, and thank you for giving me this time an opportunity to testify. Thank you very much.
Thank you very much. And what are you requesting an amendment? Is there? No? Okay, thank you. Tom Garrison, you're our final witness.
Thank you, Madam Chair. Thank you, Senator Washington, for sponsorship. I am Tom Garrison. It's good to see you guys today. I'm the president of the Southern Maryland Navy Alliance and a retired naval aviator. I just want to echo the comments by Bruce earlier that Southern Maryland stands ready to participate. And what we seek today is an amendment to incorporate Southern Maryland in the zone. We asked that with the resources right under our nose of the Aero Park Innovation District, home of the University of Maryland's UAS Research and Ops Center, UROC. It also is host to the Southern Maryland Autonomous Research and Technology Facility, or SMART. That's an $86 million, 84,000 square foot academic research site. And then most recently, we've added the Matrix Lab, an unmatched autonomous systems research site. Considering these resources, we just want to make sure that Southern Maryland is a part of the zone and a part of the team. I nominate myself as the president of the Southern Maryland Navy Alliance to participate, and I've gotten the agreement from the commanding officer of Pax River, Doug Burfield. So thank you so much to all that have supported this, and we're ready to move forward as a team in the Maryland aerospace and technology realm. Thank you.
Thank you. Do I have any questions at this point? No. Thank you very much for your testimony. That ends the hearing on Senate Bill 516 and hence ends our hearing for Finance Committee today. Thank you.